Good evening, one and all. Yeah, good evening, one and all. Welcome to International Webinar on Health and Sustainable Development on occasion of World Health Day with the theme Our Planet, Our Health. Clean our air, water, and food for healthier tomorrow. And also commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, and international webinar series on holistic health, well-being, and sustainable development. We are organizing international webinar on health and sustainable development in collaboration with Sri Holistic Health Foundation India and Sri Research Institute and Center for Arts, Sciences and Well-being. Today we have with us eminent speakers for the deliberations. Before proceeding, let's take the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
The blessings of Almighty. We continue to the proceedings of today's webinar. We welcome you all once again to the international webinar on health and sustainable development. Today we have with us eminent speakers, Professor Dr. Garima Sharma, Director, Scientist, Philanthropist, Entrepreneur. She is also Director for Jensen of Educational Impression, Turkey, Chief Editor of Monthly Educational Newspaper, that is Educational Impression, Chairperson of ENIA, Global Education and Research Foundation, Turkey, and she was postdoctoral and visiting fellow in University Science Malaysia, Penang, Malaysia, and also engages in lot of philanthropic activity and academic activities. Next we have Dr. Kanika Vasishta, Consulting Homeopath, Homeopathy for All, New Delhi. She is also Internal Auditor, NABH, and also ex-crisis and medical consultant, DCPCR, Delhi Government. And we have Srimati Divya Bharati, Nursing and Counseling Psychologist, and Sri Matt Pellestian, CEO of EQ for Peace Worldwide in USA, He is teaching emotional intelligence and social emotional learning for over 35 years in USA. And we have Sri Balaji Sundaram, Director Project Darshini, Vichintana Foundation, Hyderabad, and Sri Dr. Ravindra RM, Consultant Psychology, Medical Psychiatric Social Work, Counseling, Spiritual Mentor and Guide, member of various professional associations, and also visiting and guest faculty, and all other eminent speakers and participants. We welcome you all once again. Now I invite Professor Garima Sharma to kindly take over for the session on pharmacology and health. Over to you, ma'am. You can unmute yourself, switch on your video, and you can present your PPT. Participants can watch live on YouTube as well as can join live sessions in Zoom.
Thank you, sir, for a nice introduction. First of all, I heartfelt congratulations to the organizers to organizing such a wonderful international conference. And after that, I want to thanks coordinator of the program. So today my topic is pharmacology and health. Yes. So 1 minute.
Yeah, your screen is visible.
Okay, sir. Am I audible to all of you?
Yes.
Thank you, sir. Health is having an important role in our life. In every aspect of life, we have to take care of our health. So pharmacology and health is a very important topic. And what is pharmacology and how we can correlate the pharmacology with the health? So what is the pharmacology? As you know, in living organism, some reactions going on, like chemical reactions. And if we are taking the drug, because our health is related to the drug also. Our healthcare system is based on the drug. So when we are taking the drug, so many chemical reactions, physiological functions going on in our body, in living organism. So this is called as the pharmacology. Basically, pharmacology is a study of interaction of drugs with living organisms. It includes history, physiochemical properties, dosage forms, administration, absorption, distribution, mechanism of action, biotransformation, excretion, clinical uses, and adverse effect of drug. It includes everything about the drug.
Can you try resharing this PPT?
Okay, sir. Wait a minute, sir. Now it is visible, sir?
Yeah, yes, ma'am. Please continue.
So what is the drug? Now question is, what is the drug? As per WHO scientific group, any substance or product that is neat and intended to be used to modify or explore the physiochemical system of pathological state for the benefit of recipient is called drug. Means in simple words, we can say drug is a chemical substance which is primarily used to reverse a path physiological detect, means disease. We use drug to inhibit the disease, and drug is a chemical substance. Virtually all chemicals may be drugs, and all drugs are toxins, but not all toxins are drug. So this is the definition of drug. Drug is a chemical substance, is a chemical structure.
And these slides are not moving, not changing.
Maybe some problem because
Can you click on the slide, respective slide, and
what's that?
can you click on the respective slide once again?
Yes, sir. 1 minute again.
Yeah, now drug categories.
Okay. Drug categories slide is there, sir.
Yes.
Is visible?
Yes.
Okay, sir. So, drug categories. Two types of drug category is there. First is are used by under only medical supervision. Some drugs we cannot take by own, where if our medical superintendent or doctor will prescribe some drugs, then only we can take the drug. So are used under only medical supervision and dispensed by any order of medical practitioner only. We cannot take usually that drug, and we cannot buy this some drugs. Other is OTC drugs. OTC drugs can be sold over the counter without prescription. Some drugs we can buy without prescription. This is called OTC drugs. So there are two types of drug categories. Now, the subdivision of pharmacology. As we know, pharmacology is related to health. So pharmacology is having so many divisions like pharmacokinetics, pharmacodynamics, pharmacotherapeutics, clinical pharmacology, and toxicology. Pharmacokinetics deals with ADME, absorption, distribution, metabolism, and excretion process. That is what the body does to the drug. While we are taking the drug, then pharmacokinetics means ADME process will go with drugs, will carry on with drugs. Next is pharmacodynamics. Pharmacodynamics deal with the biological effect of the drug, its mechanism of action, and relation between plasma concentration, its response, duration of action, what the drug does to the body. Next is pharmacotherapeutics. Pharmacotherapeutics means clinical application of pharmacodynamic and pharmacokinetic information to cure a disease. Means if we want to cure a disease, so it should have clinical application. So pharmacotherapeutics deal with clinical application of pharmacodynamics and pharmacokinetics. First two steps. Fourth one is clinical pharmacology. Clinical pharmacology deals with comparative clinical evaluation of new drug for developing its therapeutic efficacy and safety, because safety is important in drug and in the field of health. So next is toxicology. Toxicology deals with the toxicity and poisonous effect of various chemicals and also with the symptoms and treatment of poisoning. So in toxicology, we can deal with toxicity and poisonous effect of and side effect of drugs and various chemical. and we can do the treatment of poisoning. Next is the chemotherapy. Chemotherapy deals with the system infection with drug with selective toxicity for infecting organism. So in cancer, we used to do chemotherapy. So chemotherapy deals with systemic infection. Pharmacogenetics. Pharmacogenetics deal with the study of inherited, means single gene mediated differences in the drug or metabolism or drug response in human. Pharmacogenomics. Pharmacogenomics deal with the genetic makeup, a genome of individual to choose drug therapy. Pharmacoepidemiology deals with the study of use and effect of drug in large population to establish risk benefit ratio of the drug. And last one is pharmacovigilance. Pharmacovigilance deal with the continuous monitoring for unwanted effect and some safety related aspect of marketed drug. Science related to DAUP, detection, assessment, understanding, and prevention. So these are all parts of pharmacology. These are subdivisions of pharmacology. Without these subdivisions, we cannot explain full pharmacology. And pharmacology is related to our health. So first one is pharmaceutic.
The slides are again not moving back.
Oh, sir, wait a minute, sir. Again, I have to.
It's still on drug categories.
Now, sir? Now it is moving?
No, ma'am. Yeah, pharmaceutical.
Yes, pharmaceutic. Pharmaceutic is a part of pharmaceutic is a part of pharmacokinetics. Pharmaceutic, 80% of drug taken by mouth. As we know, we are taking 80% of drug by orally. And pharmaceutics in the first phase of drug action. When we will take the drug, first dissolution, pharmaceutic means dissolution of the drug will take place. It is the first phase of drug action. In gastrointestinal tract, drugs need to be in solution to absorb. So like solids, tablets, and capsules must disintegrate into small particles to dissolve into liquid. So liquid drugs are already in solution, but tablets and capsule, we have to disintegrate, or these things disintegrate in our gastrointestinal tract into small particles to dissolve into liquid. So tablets are not 100% drug based. Fillers called excipients used for size, shape, and dissolution of drug. So this is the first step of drug action. It is having three parts: disintegration, dissolution, and rate limiting time. First is disintegration. Disintegration means breakdown of the tablet into smaller particles. First, tablet will break down into smaller particles. Dissolution means dissolving of the smaller particle in gastrointestinal fluid before absorption. And rate limiting time, it takes the drug to disintegrate and dissolve to become available for the body to absorb it. So it is having three parts: disintegration, dissolution, and rate limiting time. The process of drug movement to achieve drug action, it is having 4 steps: absorption, distribution, metabolism, and excretion. It is called ADME, and it is a very important step to achieve drug action: absorption, distribution, metabolism, and excretion. So what is absorption? When drug passes into the blood or in circulating into the body fluids, the rate of absorption depends on the route of administration. Means it depends on how we are from which route we are taking the drug. We are taking drug internal, we are taking the parenteral, we are taking the drug percutaneous. So it depends on the administration. Rate of absorption depends on the administration. Passive, active, and pinocytosis are different type of absorption. So we are having different type of absorption like passive, active, pinocytosis, and passage of drug from its site of administration into the blood or circulating body fluids. Next is bioavailability. Bioavailability is a subcategory of absorption. It is a subcategory of absorption. The percentage of administered drug dose that reaches the systemic circulation is called bioavailability. It will occurs after absorption and hepatic drug metabolism. Oral route of absorption is always less than 100%. Intravenous route is usually 100%. When we are taking the drug by oral route, so its absorption always less than 100%. But when we are taking intravenous route, it is usually 100%. Next is distribution. Now, drug absorbed in the blood. Now, now distribution and how it will distribute. So distribution influenced by blood flow, affinity to the tissue, and protein binding effect. These 3 things influence the distribution. The way in which drugs are transported by the circulating body fluids to the site of action. Drugs are distributed in the plasma and are bound to varying degree of protein like albumin. So distribution influenced by 3 things: blood flow. If blood flow is less or blood flow is more, so it will affect the distribution. And affinity of the tissue and the protein binding effect. These 3 things influence the distribution. Portion of drug bound is inactive, not available to receptors. Now distribution is going on, and portion of drug unbound is free. Active only free drug can cause a pharmacology response. Some circulating drugs like anticonvulsant drug, aminoglycoside drug are checked for drug blood levels. We can check the drug blood level. Some drugs we can check like anticonvulsant or aminoglycosides. But we need to aware of the condition of our patient when we are giving this type of drugs. So we need to aware the condition of our patient, like liver or kidney disease. Means in liver or kidney disease patient, low serum albumin level, less protein binding sites, excess free drug or drugs toxicity. Means if patient liver and kidney is not okay, or they are suffering from the liver or kidney disease, then their albumin serum or albumin level low, then after that albumin level is low, then protein binding site will be less. Then drug will be free because no binding site. Then excess free drug will be there, and this will cause the drug toxicity. So we should remember the amount of drug that actually reaches the receptor site determines the extent of pharmacological activity when we are giving drug to the patient, especially in the liver or in kidney disease. Now is the excretion. First is absorption, then distribution, and now is the excretion. Excretion, major mechanism of the termination or inactivation of drug action. Excretion is the major mechanism to the termination, inactivation of drug action. So liver is primary site where drug is inactivated by liver enzymes and become inactive metabolites or water for excretion. Means half-life, means we can that half-life of the drug, the time which takes for half of a drug to be eliminated, this is called as the half-life of the drug. So excretion is a major mechanism for the termination of inactive drug, and liver is the primary site where drugs are inactivated by liver enzyme. So if we are having excess free drug, so liver will inactivate the excess free drug by liver enzyme, and after that the drug will eliminate from our body through excretion. So excretion is means excretion means where body can excrete the drug through different routes. Like main route is through the urine. Other routes like bile, feces, lungs, or breast milk. And urine pH influence excretion. Kidney disease affect excretion. If we are having kidney disease, and so it will affect excretion because kidney will not work properly and will not excrete the whole drug. Some part of the drug, some inactive drugs will be in our body, remain in our body. So main route is urine, but other route is bile, feces, lungs, breast milk. Now, in previous, I was talking about the pharmacokinetics, and pharmacokinetics having 4 things: absorption, distribution, metabolism, and excretion. Second is pharmacodynamics. Pharmacodynamics means the drug mechanism of action. In pharmacokinetics, we have taken the drug, then drug will absorb, then distributed in the body, and that after the metabolism of the drug, then after that inactive drug excrete from the body. But in pharmacodynamics, we can see the drug mechanism of action, drug response. So drug response can cause a primary or secondary physiological effect, or both effect. Primary effect is desirable, means we want for primary effect, but sometimes secondary effect is undesirable, sometimes desirable. So in pharmacodynamics, deal with the drug mechanism of action. Pharmacodynamics having 3 steps like onset of action, peak action, and duration of action. Onset of action means time it takes to reach the minimum effective concentration. And peak action means when the drug reaches its highest blood or plasma concentration. It is called as the peak action. And duration of action means length of time drug has an effect. So most receptors are protein in structure and found on the cell membrane. So pharmacodynamics having three things. After that, drug mechanism of action will be on the receptors. Although all drugs lack specific and selective effects, means all drugs, it is having less specific and selective effects. These other effects may be desirable or harmful. Means we want some effect, we want to cure some disease, but sometimes some other side effects can occur with desirable effects. So drug acts through receptors by binding to the receptor or to produce a response or block a response. So most of the receptors are protein in structure and found on the cell membrane. When drug will work on the mechanism of action of the drug will work on the receptors, and all receptors are protein, and they protein are found on the cell membrane. So some drug acts through receptors. If drug will bind to the receptor to produce a response or block a response, two things will happen. First, it will produce a response, and second, it will block a response. Next is the therapeutic index. Therapeutic index come in the pharmacodynamics. Therapeutic index estimate the margin of a safety of a drug, because safety is an important part of the drug. Means low therapeutic index, narrow safety. High therapeutic index, wide safety margin, less danger of toxic effect. So therapeutic range, area between the minimum effective concentration and minimum toxic concentration. If we are having low therapeutic index, it means narrow safety. But if drug is having high therapeutic index, so wide safety margin, less danger of toxic effect. So therapeutic index is necessary for the drug. Next is side effects. Side effect means adverse reactions. So side effects usually with drug, the lack of specificity causes drowsiness, and some other adverse reactions more severe than side effect can be mild and can be very mild or cause anaphylaxis. So side effect side effects of the drug or adverse reaction of the drug is very less. Sometimes it is severe, sometimes it is less. It depends on the drug therapeutics index. So now we are having the 5 rights of the patient, because we are talking about the pharmacology and the health. And in health, pharmacology related to the drug, related to the drug administration, drug dissolution, drug excretion, drug side effect, all the things. So the 5 rights of the patient we should know. The patient should give right drug. The patient receive the drug prescribed. If doctor is prescribing a drug to the patient, so it should be right. We should not give the wrong drug to the patient. It is the right of the patient. Next is the right dose. Right dose, it is the right dose within the recommended range for the particular drug. Patient should give the right dose. Next is the calculation and unit dose. We can calculate the right dose or unit dose. So patient should know the prescribed drug. Patient should know the right dose. Next, the patient should know the right time. The time the dose should be given, twice a day, thrice a day. QID means 4 times a day. Q6H means every 6 hours. Q day means daily. Q4th PRN means as needed every 4 hours. So patient should know the right time when he can take he and she can take the drug. Patient should know the right route. How is the drug to be administered? Do not crush a drug. Do not change the route on your own. So we should keep the 5 right things about the drug. First, the right route of drug, the right time of the drug, right quantity of the drug, and right drug or prescribed drug. Right documentation of the drug, right assessment, right to education, right to evaluation, and right to refuse the medication. So patient should have all the rights: documentation, assessment, education, evaluation, and refuse the medication. So now
And these slides are not moving.
1 minute, sir. Again, I'm
Sources of information.
okay, sir. Because pharmacology and health is a it is a wide topic, and uh, we cannot discuss in just 1 hour. So I'm taking less things. Source of information, from where we can know about the drug, about related the drugs. So we are having pharmacopoeias. We are having pharmacopoeia, and in pharmacopoeia, drug formulas is there. So we are having British pharmacopoeia, Indian pharmacopoeias, United States pharmacopoeias, and in these pharmacopoeias we are having pharmaceutical codex, and national formulary by American Pharmaceutical Association, National Formulary of India. So we are having pharmacopoeia, official pharmacopoeia, and non-official Martindale also. So from pharmacopoeias, we can know about the drug, how to how to administration the drug, how to deal with the drug, and the how to ADME of the drug. It is all in the pharmacopoeias. So pharmacopoeias is a important source of information related to drug. Next is non-official compendia. Some non-official or secondary source of drug information by the generic name or trade name we can take. This information in generalized and not in restricted to only those drugs, like AMA drug evaluation by American Medical Association and Council on Drugs, like modern drug encyclopedia by Yorkie Medical Books or New York, USA, by Physician's Desk Reference PDR by Medical Economics Publication USA, Martindale Extra Pharmacopoeias by Pharmaceutical Society of Great Britain. So these are the non-official information. We can take non-official source of drug information from these resources: AMA drug evaluation, modern drug encyclopedia, physician drug reference PDR, or Martindale Extra Pharmacopoeias. Drug nomenclature. So how we can keep the name of drug. So a drug generally has 3 category of names: chemical names, or official name, or approved name, and brand name. So like it describe, in chemical name, it describe the substance chemically. Example, 1,3-propane, 2-all for propanol. But in official books accepted all over the world, the approved name or official name. And crocin is a brand name for paracetamol. So many drugs is having brand name, so many drugs is having approved name, and the approved name in the official, we can write approved name in the official books, and it is accepted all over the world. And chemical names is the just a salt name, and if we are taking crocin, so we can see it is paracetamol is there, and we can see the salt in the drug. So here you can see some pictures of the drug like paracetamol tablets. So here you can see that its brand name is Calpol, and it is having paracetamol tablet, and it is 500 milligram tablet is there. Next, you can see the crocin pain reliever. It is the brand name is Crocin, and here also you can see Ciflox 500. It is brand name is Ciflox 500, and the it is ciprofloxacin hydrochloride tablets. So brand name is different, and chemical name is different, and trade name or approved name should can be different. So what is the essential medicines? So in WHO defined the essential medicine, those medicines that satisfy the healthcare need of the majority of the population is called as the essential medicines. They should therefore be available at all times in adequate amount and in appropriate doses form at the price of community can afford. Means some medicine, headache medicines, fever medicine, and some vitamins and other medicines, it is called as the essential medicines. And WHO called them essential medicine because it should be there. It should be there in available or at a community price, and it should be available at low price and all the community can afford, and it should be available all times in adequate amount in appropriate doses form. So this is called the essential medicines. So what next is the orphan drugs, and some drugs like sodium nitrite, famipazole, liposomal amphotericin B. This type of drugs is called as the orphan drugs. So these are drugs or biological product for diagnosis or treatment or prevention for a rare disease or condition, or a more common disease for which there is no reasonable expectation that the cost of developing and marketing it will be recovered from the sale of the drug. So this is called as the orphan drugs. Government in developed countries offer tax benefits and other incentives to pharmaceutical companies for developing and marketing orphan drugs, like in Orphan Act in USA. So orphan drugs is drugs that are biological product for diagnosis, treatment, or prevention of a rare disease or a condition. For not common disease, rare disease or condition. So what is the law governing drugs? Yeah, drug schedule. So we should know about the drug schedule also. Schedule 1, Schedule 2, Schedule 3, Schedule 4, and Schedule 5. In drug, the drug pack, in drug, so it mentioned there Schedule 1 drug, Schedule 2 or Schedule 4 drug or Schedule 5. So what is the schedule? Includes the drug with high Schedule 1 is the drug with high potential of abuse like heroin, marijuana, or methaqualone. This is called as the Schedule 1 drug. And these drug distribution are as per the USP volume 22 by NF. And what is this Schedule 2 drug? Schedule 2 drug is morphine, codeine, cocaine, and methyl penidate. This is called as the Schedule 2 drug. And Schedule 3 drugs includes a drug with moderate physical and psychological difference like ketamine, narcolepsine, thiopentine. This type of drug is Schedule 3 drug. Schedule 4 drug, they have low potential for abuse and have limited physical and psychological dependence, long-acting barbiturates, benzodiazepines, pentazocine. This type of drugs is Schedule 4 drug. And Schedule 5 drug, they have minimal use abuse potential and minimum dependence liability, like Lamotil and formulation containing codeine with others are OTC drugs. So when we are taking some OTC drugs or some special drugs, so we should know about the Schedule 1, Schedule 2, Schedule 3, and Schedule 4 and Schedule 5 drug. So here you can see the schedule. It is having different schedule, different things, like G means H. Here you can see H, prescription drugs, and J, list of elements. K, exemption from provision of Chapter 4 of Drug Act. M, GMP. M1, MGF of homeopathy's drug. So all these schedules, we should know about the schedule, because while we are taking the drug, because it is very important to know the schedule, to know the meaning. These all the schedules, different schedules, like P is expiry period, and O is disinfectants fluids. So W is name of drugs which can be marketed under generic name only. And U1 MGF records. V is patent and proprietary medicines, and S is standards of cosmetics. So these are the schedules. We should know the schedules. So next is drug approval or drug names. How we can approve the drug? As I told, pharmacology means that it is a very wide topic. We have to cover all the things. And so drug approval means drug names. Each drug may have several names, like chemical name, official name, universally accepted name, and brand name, or like a chemical name describe the drug chemical structure, most meaningful to the chemist. And official name means for the drug, because if we are chemist and if we are in the field of a drug, and we are working in the healthcare, we are a healthcare professional, we know the chemical structure, drug chemical structure. So we can see the chemical name or chemical form structure in the chemical name in the drug. But if a common man, they don't know the chemical name, but they know only the brand name, like for crocin is a brand name, or maybe all people know about the crocin, but it is having paracetamol. So so common people know only brand name or trade name, but as we are health professional, we know chemical name also. And like the Cardizem is a brand, and Diltazium HCl is a generic name. So it can be different. It can be chemical name, official name, brand name, universally accepted name can be different. So thank you. Because the topic is very wide, so I cannot take all the things in just 1 hour and just 45 minutes. So thank you very much. Any question from the participant side, you can ask me.
Thank you, ma'am. It was a very insightful session. And though there was some technical issue with the slides.
Oh, yes, sir.
The slides with me.
I don't know why, sir, because it is going on so many times. Again, I stop and share. Maybe some technical issue, sir.
Otherwise, the session was really wonderful. And thank you for sharing the insightful session. On the topic of pharmacology, this is very important. To bring awareness to the patients about various drugs.
Yes, sir. It is a very wide topic. So we cannot take all the things in just 1 hour. It is very wide topic because all pharmacology related to health. It is very wide topic, sir.
Yes, ma'am, we do understand. So definitely we will take up, if time permits, some other day.
Yes, sir.
And, a lot divide into topics and gain insights.
Yes, sir.
So due to paucity of time, we'll take queries at the end of the sessions, ma'am.
Okay, sir.
Don't think participants have any queries. But if you can share your PPT, that will be very useful.
Sure, sir. I will share my PPT, and if any question from participant side, they can contact with you, and you can forward the questions question with me.
Sure, ma'am, definitely, ma'am. We'll quickly take one question from Michael.
Yes, sir.
Mr. Michael?
Yes, sir. You can ask.
金钱看齐，两场协作。
Hello.
Participants can type your queries in chat box. We will take it up with the speaker and we will get back to you. If your time permits, you can stay back, ma'am.
Yes, sir. No problem, sir.
Okay, ma'am. Thank you, ma'am.
Thank you, sir.
Joining us and accepting our invitation.
Thank you, sir. Thank you. Thank you very much, sir, for giving me such opportunity. Thank you, sir.
Thank you, ma'am. Look forward for your sessions, presentations in future as well.
Yes, sir. Thank you, sir.
Thank you, ma'am. Wishing you all the success.
Thank you, sir.
So we shall move on to our next speaker for the day. After listening to the wonderful, insightful, enlightening session by Professor Dr. Garima Sharma ji, we'll move to the next session by Dr. Kanika Vasishta. She is consulting homeopath from New Delhi. Kanika, can you unmute yourself? And switch on your video and you can try now.
Yeah, now it's working.
Yeah. So welcome you for this wonderful webinar and
Yeah, thank you, sir.
session on holistic homeopathic intervention in allergy.
Yes, I will.
Try sharing your PPT.
Yes, I'm trying. Wait. It is not showing my files. Wait.
You have to open your PPT first in the system.
Okay.
Use the share button and you can see the open windows. You can select the respective window.
Now, can you see, sir?
Yeah, ma, it's visible.
Is it visible in the full screen also?
It's in slide mode. You can Click on full screen mode.
Actually, I've already done that. That is what is happening, I think, with ma'am, Garima ma'am also. I've opened in SlideShare, but it is not opening.
Acha. Okay, there might be some issue. Okay, you can continue in the slide mode as well. So,
Okay, so hello everyone. I'm Dr. Kanika. I'm from New Delhi. And firstly, I would like to wish everyone on this special occasion of Health Day. Don't just make it a day, but a mission in your life to have good health. Not just physical health, but emotional, physical, mental, psychological, and spiritual. That is the definition given by WHO, and that is how everyone should live. Not just by physically active, but mentally also, spiritually also, and emotionally also. I would like to thank Shri Health Foundation India and Shri Research Institute and Center for Art, Science and Wellbeing for conducting these seminars on holistic healing and sustainable development to promote nothing but good health. I would like to thank Dr. Ravindra sir also for giving me this opportunity to present my knowledge and my experiences on the topic which is very close to my heart, that is health, and on this special day, that is Health Day. So before I begin, I would like to say that allergy is very subjective, and allergy is something that you cannot just stop. Allergy enters every household, and it is there all the time, and it especially increases during this season when there is a seasonal change from summer to spring or from autumn to winter. And when it is happening to you, it is really worse. You don't feel like doing anything. You wake up with lethargy, you wake up with itching, you wake up with sneezing, you wake up with throat pain and headache and sinusitis and everything. But when it is happening to someone very close to you, like your children or your father or mother, then you feel more pain because you cannot see them in pain, and you want to do everything that is possible in your hand to make it better for them. So in this presentation, I would like to first tell you about what is allergy, what are the causes of the allergy, the types of allergy, how they represent, means what are the symptoms of the allergy, and what does the normal convention, means the modern science, how it helps, how does homeopathy help, and what is the holistic approach, means what are the other forms where we can actually help the patient to live a quality life. See, giving patient a quality life, that is our motto. That should be our motto, and living a quality life for you, that should be your own motto. So before I begin, I want to say that just like you do your daily work, just like you do your hard work for your job, similarly, health is also a process, and attaining good health is hard work. So you should also do some of the hard work for your health also. So with that in mind, I would like to start. Like, for example, what is allergy? Allergy is very individualistic and to each his own medical condition. What does that mean? It simply means that what your body is allergic to, others may not be, or vice versa. For example, two people are walking outside in the park, and one suddenly starts sneezing, and the other is absolutely fine. The same two people go inside the house, and the second one starts sneezing, and the first one is fine. So it is a very individualistic. Why that happens is because our immune system starts mistaking the harmless substance, that is dust or pollen, entering our body as harmful. And in that process, there is a chemical that is released in our body, which is called histamine, which is found in our body cells, which is released in our bloodstream, and it dilates our blood vessels, which causes that sneezing, that snuffles, and that throat ticking and cough, which is called the hypersensitive reaction. This leads to sudden hypersensitive reaction coming out with a number of symptoms following contact with the allergen, which is the trigger of allergy. Here I will present a short video where you will understand what I've just told you. I think it will open in the slideshow, but
An allergy is an overreaction of the
Can you
immune
see?
system to a normally harmless substance called an allergen. Common allergens include pollen, animal dander, down feathers, mites, chemicals, and a variety of foods.
Only audio is
On first exposure, the inhaled allergen enters the mucous membrane.
What, sir?
only we can hear audio, ma, no video.
Yeah, okay. I'll
Pollen, animal dander. An allergy is an overreaction of the immune system to a normally harmless substance called an allergen. Common allergens include pollen, animal dander, down feathers, mites, chemicals, and a variety of foods. On first exposure, the inhaled allergen enters the mucous membrane lining the nasal passages, where it is taken up by the antigen-presenting cell, which presents it to the T cells. These T cells activate the B cells to release substances called IgE antibodies against the allergen. These IgE antibodies sit on the surface of the mast cells. The mast cells have granules containing chemical mediators like histamine and prostaglandins, etc. On exposure, the allergen binds to the IgE antibodies present on the mast cells, cross-linking them. This results in the release of histamine, prostaglandins, and other mediators into the surrounding tissue. These mediators cause dilation of the surrounding blood vessels and increase their permeability. This results in the nasal stuffiness, sneezing, and mucus discharge of allergic rhinitis. Antihistamines work by blocking the action of histamines at its receptors and thus decreasing the body's reaction to the allergen.
So this is what I was talking about. A small video to make you understand. Okay. So now I will discuss about the causes of allergy. What are the causes of allergy? Now, researchers all over the world are still not very clear about what actually causes this allergic reaction, but it is known to have genetic component. That doesn't mean that if the mother is allergic to egg or shellfish or any seafood or even any food item, that doesn't mean the child will be allergic to it also. Some of the trigger of allergy, which are called allergens, include animal product, which include pet dander, dust mite, waste, and cockroaches. Drugs, some of the drugs, some patients do not react well to some of the drugs. That is why whenever you go to a hospital, they always ask, are you allergic to some drugs? Because they should know what are the drugs that you are allergic to, and they will not give you that. Some of the food items like wheat, nuts, milk, shellfish, and eggs. These days, gluten is the most common food item most of the people are getting allergic to. Then insect sting like bees, wasp, and mosquitoes. Then mold, airborne spores from mold. Then plants. During this time when there is season change, when there is pollen in the air. So pollen from grass, wheat, and trees, and resin from the plants such as poison ivy and poison oaks are very common plant allergen. Other allergens include latex, which is often found in latex gloves and condoms. And some of the metals like nickel, aluminium, and copper, some of the patients are getting allergic or are known to be allergic to these metals also. The types of allergies. Now, what are the types of allergy? Nasal allergy, which is also called allergic rhinitis. Then allergic cough, asthma. It is a very common condition, and it is worldwide known to have caused distress to many people and many children. Skin allergies, which consist of dermatitis, itching all over the body, and urticaria, which is called hives. There is elevation of skin, and there is redness of the skin with feverish feeling. Food allergies, then allergic conjunctivitis, which is also called pink eye, then allergic sinusitis, some of the dust allergies are there, and severe allergy leading to anaphylaxis. This is the complication of allergy. Okay, now what is nasal allergy, which is allergic rhinitis? How does it represent? The symptom include constant sneezing, then fluent discharge from the nose. The nose is always running. Then itching, there is itching. The patient is always scratching their nose, or the children, they are scratching. These days, many of my patients or children, they are coming with this symptom, allergic rhinitis. In the morning, they wake up with sneezing, and it lasts throughout the day. When there is evening, yes, the symptoms start to subside, but in the morning it is worse. Then some of the discharge, it goes in the throat, and it causes itching in the throat. It causes cough. There is itching in the ears, then discharge from the eyes, itching in the eyes, feverish feeling, and headache. Asthma, how does it represent? There is cough with difficult breathing. There is suffocation. There is tightness of chest, then wheezing and whistling sound from the chest, mucus accumulation in the chest. Now, because asthma is known to cause a lot of distress to people all around the world, I want to share a short video again where you will know how asthma causes distress.
It starts with a cough or a wheeze. Soon, your chest feels tight. Your breathing speeds up and gets shallower, making you feel short of breath. These are common symptoms of an asthma attack. Around the world, more than 300 million people suffer from asthma, and around 250,000 people die from it each year. But why do people get asthma, and how can this disease be deadly? Asthma affects the respiratory system, particularly the smaller airways, such as the bronchi and bronchioles. These airways have an inner lining called the mucosa that's surrounded by a layer of smooth muscle. In people with asthma, the airways are chronically inflamed, which can make them hyperresponsive to certain triggers. Some of the many asthma triggers include tobacco smoke, pollen, dust, fragrances, exercise, cold weather, stress, and even the common cold. When people with asthma are exposed to these triggers, an asthma attack or exacerbation can occur. But how exactly do such everyday factors lead to an asthma attack? If an asthmatic is exposed to a trigger, the smooth rings of muscle that circle the small airways in their lungs contract and become narrow. Simultaneously, the trigger worsens inflammation, causing the mucosal lining to become more swollen and secrete more mucus. Under normal conditions, the body uses this mucus to trap and clear particles, like pollen or dust. But during an asthma attack, it blocks the narrowed airways, making it even harder to breathe. These effects lead to the symptoms of asthma. Smooth muscle constriction results in the feeling of chest tightness. Excess mucus and increased inflammation can cause coughing, and the wheezing noise? That happens because as the airways constrict, air whistles as it passes through the narrowed space. These symptoms may make a person feel like they're running out of air. Yet counterintuitively, during an asthma attack, the inflammation can make it harder to exhale than inhale. Over time, this leads to an excess of air in the lungs, a phenomenon known as hyperinflation. The trapping of air inside the lungs forces the body to work harder to move air in and out of them. Over time, this can lead to reduced oxygen delivery to the body's organs and tissues. Sometimes, in untreated severe asthma attacks, the body can't keep up, which can lead to death from lack of oxygen. So how do we prevent these uncomfortable and potentially fatal attacks in people who have asthma? One way is to reduce the presence of triggers. Unfortunately, the world is an unpredictable place, and exposure to triggers can't always be controlled. This is where inhalers, the primary treatment for asthma, come in. These medications help asthmatics both control and prevent their asthma symptoms. Inhalers transport medication along the affected airways, using a liquid mist or fine powder to treat the problem at its source. They come in two forms. There are reliever medications, which treat symptoms immediately and contain beta agonists. Beta agonists relax constricted muscles, allowing the airways to widen so more air can travel into and out of the lungs. The other form of inhalers serve as preventive medications, which treat asthma symptoms over the long term and contain corticosteroids. Corticosteroids reduce airway sensitivity and inflammation, so asthma can be kept under control. They're also crucial in preventing long-term damage from chronic inflammation, which can cause scarring of the airways. Inhalers are known to be very effective and have helped many people live better lives. Although we've come a long way in improving how we treat and diagnose asthma, we still don't know its exact causes. We currently believe that a combination of genetic and environmental factors play a role, potentially acting during early childhood. Recent research has even linked poverty to asthma incidence. This may be due to reasons ranging from exposure to additional pollutants and environmental irritants to difficulties in obtaining medical care or treatment. As our understanding of asthma improves, we can continue to find better ways to keep people's airways happy and healthy.
The other type of allergy includes skin allergies. The symptoms include itching all over the body or localized in some part of the body, urticaria, which are the hives, which are the elevation of the skin, which happens when they eat something or it just happens because of the environmental factors. Then eczema, which is allergic dermatitis, food allergies. Food allergy, how does it show? Where there is swelling of lips, mouth, and face. There's skin symptoms, which include itchy rash and eczema. Nasal symptoms, which include discharge from nose, itching in the nose and eyes, and difficult breathing. Gastric symptoms, which include loose motion, stomach ache, nausea, and vomiting. Diagnosis of allergy. How do we diagnose the allergy? There are many types of tests we can do to understand how allergy is diagnosed. Skin prick test, intradermal skin test, blood test, which was shown in the first video, that the specific IgE antibodies are shown in increased amount in these individuals. Then there is patch test. In the blood test, the ESR, the erythrocyte sedimentation rate, is increased. So are C-reactive protein and WBC count. Now there are some limitations where there is complication of allergy, which happens anaphylaxis, which is called anaphylaxis. It can develop in just seconds after the exposure to the trigger, which is the allergen, and it is a life-threatening condition. Why it is life-threatening? Because there is swelling of airways, which I just showed you in that video also. There's inability to breathe and sudden and severe drop in blood pressure. There, the patient should not wait, and they should seek immediate emergency help. Without treatment, it can lead to fatality. The normal convention, what does it say, is that once it is known what is causing this allergic reaction, it is recommended that you should avoid exposure to that particular allergen, seek medical care when the symptoms are disrupting daily life, and be sure to get treatment when there is anaphylaxis, which is the severe form. You may not be able to avoid an allergic reaction completely, but you can prevent future allergic reaction. This is the normal convention which is being told. But there is a hope, there is a way to actually improve the quality life for the patient by homeopathy. How does homeopathy works is homeopathic remedies for allergy not only provide relief, but also help to cure the condition, which in turn gives quality life to the patient. How does it work is it is based on individualistic approach, which I told you in the first slide only, that allergy is individual. It is to each his own. So homeopathy is also individualistic, which means when two patients are coming to me, I don't give them the same medicine. I have to understand both of them separately, and only then I can give them medicine. Homeopathy is based on individualistic approach, which means every patient has different needs. So the medicine is different for different individual. Medicine, how the medicine are selected? They are selected on the basis of the symptoms narrated by the patient and the trigger of allergies which are giving them trouble. For example, recently there was 2 cases of urticaria that came to me, one girl and one boy. The boy, he was from the state of Bihar and he was living in Delhi for many years. And he came to me, and his whole body, whenever he used to eat, his whole body used to have this skin elevation and there was fever. So when he came to me, he told me his symptoms, and I understood that being away from his family and having less food or less nutrition food and having erratic sleep, he was having all these symptoms. So apart from my medicines, I gave him a diet also, and I told him how to improve his life, and it really helped him. The other girl, the other patient, the girl, she also used to have the same symptom, but it used to happen during the morning time. And she was having this symptom because she was going through her examination phase. She was going through, I think, 3rd year of college, and she was very much stressed. And whenever she used to go in that stress, this condition used to worsen. So I had to make sure that I not only give her medication, but a way for her to live a good life. See, we cannot remove the examination part, but yes, we can make sure that the girl doesn't feel that stress or is able to cope up with that stress without having effect on her health. So homeopathic medicine, and also because homeopathic medicine are holistic, which means they are derived from the natural products. Hence, the adverse reaction to human body is nil to zero. People are taking cetirizine, levocetirizine for many years, and it helps also. And I'm saying that during the time when it is actually needed, during emergency, it is definitely required. But over a long period of time, it does show effect on the human body, some kind of side effect. Whereas homeopathic medicine, they can take for a longer period of the time without having any other effect in any other organ of the body. And it actually improves their condition. For example, if a patient comes to me and they say that they have been suffering through allergic rhinitis for over, let's say, 10 years. So it may happen that the next season, they will have the symptoms which are in less intensity, and the following year they will have less. So gradually it will improve, and they can take this medication for a long period of time to improve their quality of life. The other ways to take care of allergies, which I have now found out, is through these OTCs that Garima ma'am also told, that vitamin C, you can inculcate vitamin C, vitamin A, vitamin B complex, vitamin E, and zinc. During Corona lockdown, you must have heard government saying take vitamin C, take vitamin B complex. Why? Because vitamin C and vitamin B complex are known to have decreased quantity during stressful period. Whenever a person is in stress, these 2 vitamins are less in the body. And these 2 are very much essential to increase the immunity for the body. So that is why vitamin C, vitamin B complex, vitamin A and E and zinc, these are very much required to combat these allergic conditions. Also, the diet part, eating whole grain, fruits, beans and sprouts, it also helps. You can add a lot of color in your food plate. What does that mean? That means that I have written a very good article on it. I don't know if it will open here or not, but that means that you can add different type of bell peppers which are rich in antioxidant. You can add paneer or tofu. You can add different types of good greens vegetables, so that they are richly packed with different vitamins and minerals, which normally people skip. What do they eat? They eat dal or roti and rice, and that's it. Yes, that is fine also, but you need to add other food items which are packed with other essential vitamins and other essential antioxidants. Occasional juice fasting and increased fiber in diet, which means add salads in your diet. And make sure you can try eating salad 10 minutes before you eat your food. Sometimes what happens is people eat salad along with the food. That is also a good convention, but try eating salad before the food. It will actually increase your diet, and it will actually help you flush out your food much faster. People get constipation, so it will help you in that. Avoid meat, sugar, and artificially colored food, which means food from outside. You should avoid that. Yes, sometime if there is no option, you want to go outside, you have to eat outside, then that's fine. But try to avoid the artificial colored juice, artificial colored food, and sugar. The other way is to manage stress on a daily basis. Now we cannot separate stress on our daily lives after corona, and the way the workload has increased and everything has increased. We can only manage our stress, and we should manage our stress. Like we cannot forget to put on the clothes, so we should not forget to take care of our body and mind. We should do these physical activity, which has become zero. Most people are not doing their physical activity at all, at least 30 minutes a day, such as yoga, pranayam, and aerobic exercise. Why aerobic? Aerobic means oxygen. Aerobic exercise, actually you take in more oxygen, which is very much essential for living thing, which is very much essential for healing. When you get a cut or a wound or a burn, how does it heal? You clean it with the surrounding air. With the surrounding air, it heals. But when people who have piles or anal fissures, during that time they get really pain. And why that is happening is because they are not exposed, that part is not exposed to the environment. So because of that, it decreases the healing, it decreases the healing time. Take time out during weekends for a short trip. Go with your family, spend time with your family and your pets. It is deeply relaxing. You can see online also, there are many videos of pets. Why? Because spending time with pets, or spending time with babies, playing with them, is actually very relaxing. Why? It increases the level of endorphins and serotonin in our body, which are the happy hormones. These are the hormones which create a feeling of tranquility, a feeling of happiness inside. When you're happy from inside, obviously your body is already in the healing mode. Now, laughter. People have stopped laughing, or they think, okay, laughing, why would we laugh? But it is actually very helpful. Inculcate humor in life. It is very important to laugh. I have talked about this in my videos, how psychology affects immune system and causes disease. This, and lastly, is please be open to your doctor. The doctor is only trying to help you. Okay, tell all your concern, whatever your issues are, whatever you feel your queries is, ask your doctor. Be open with your doctor. Try different things. Like I said, I don't even just give medicine. I give a 360 approach. I try to give 360 approach for my patient, because it is not just the medication that will help you. Medication liya theek ho gaya, nahi. We have to maintain good health. The key word is maintaining good health, to be happy and to lead a very good life. And just start today from small step, one step at a time, and you will actually feel very nice. So this is what I wanted to talk about. So thank you so much. And if there is any questions or queries, I would be more than welcome to answer.
Yeah, thank you, Kanika, for the wonderful presentation. Participants, if you have any queries, you can raise your hand or put your query in chat box. We are running out of time. Kanika, we will take it at the end of the session. Otherwise, participants can use a feedback form to provide your queries or clarification comments, where we can get back to speakers and get back to you as well.
Okay.
Thank you, Kanika, for joining us and accepting our invitation. Wishing
Thanks
you all
for
the
inviting me, sir. Yes.
and kindly do share your PPT.
Okay, sir. Yes.
Okay, thank you. So let's move on to our next speaker for the day. We have with us We have with us Sri Matt Perleston from EQ for Peace Worldwide Inc. USA. He is teaching emotional intelligence and social emotional learning for more than 35 years. Over to you, Matt, for a session on emotional intelligence and health. Can you unmute yourself?
Yes, I did. Am I audible now?
Yeah.
Yeah, very good. Okay, well, thank you. All right, welcome everybody. Thank you for having me. Congratulations on our special day of health. As the last speaker just spoke, that was a very nice presentation. There's a number of different types of health, and a holistic health, it includes all of them, which is cool, including emotional health. And that's the part I want to talk to you about. So we're going to talk about emotional intelligence and positive mental health. Positive mental health usually has kind of a negative connotation to it, but we are going to spin it positive. Because there's positive things we can do with it. There's a lot we can do with it. So let me share my screen and we will get started because we don't have much time. This stuff is not very complicated. It's not difficult. No, it's not. Well, it's not complicated. It's fairly simple, but it's not easy sometimes. So there's a lot to it. So let's get started. We are going for peace. We have a nonprofit in the United States, but it's worldwide, and we are going for peace because we need it badly, as you probably know. And we are saying that world peace starts with inner peace, right? We start within us. So thank you to all the people that are givers, professors, social workers, caregivers, all those that help other people. Should have started there, sorry. But I wanted to thank everybody who is helping other people, because that, I think, is also a way to get to peace for us and for others. I want to introduce you to positive mental health and emotional intelligence. If you don't know too much about those, it's very, 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 very important, in my opinion. I think it's a life changer for so many people when they start to realize that they can manage their own inner world, and that gives us peace to know that we are in control. We have the power to make our lives look and feel, more importantly, feel as nice as we want them to. We have that power, not other people. So I'll talk about that. I want to show you how to bring peace into your life, and I already started. It's about us having control of our inner world. Spoiler alert. And inspire you to incorporate emotional intelligence and positive mental health into your life. Because it is huge and changes everything. It's a wonderful, wonderful thing, and no cost whatsoever. No cost, no dollars, none. So all of this is free inside of all of us. It's our own inner world that we're talking about. And so I would also like is that you would share this with other people, because most of us don't know. Most people don't know how to control their emotions, and it's not rocket science. And it is, like I said, we're born with it. We are free. It's all free inside of us, and we can do this. And please share it with other people, because they don't know. This is kind of the basis of all of this, is that world peace, which is what we're shooting for, begins with inner peace. So that's what we're going to work on. We'll see if this works. We don't know yet. Hard to prove yet. It's going to take a little while, but we're going to give it a try. And so we're going for inner peace, and feel peaceful in the meantime, even if we don't have world peace, but hopefully we'll get there. So the Dalai Lama said, through inner peace, genuine world peace can be achieved. That's a big deal in itself, because a lot of people don't think that world peace is even possible. He says it is. I agree. I think it is possible if we have enough of us that know emotional intelligence. Peace must first be created within ourselves, then gradually expanded to our families, our communities, and ultimately the whole planet, right? So that's where we're going with this. By the way, I have way too many slides, so I'm going to go fast. Sorry, but here we go. Hang on. Start with inner peace inside of us. Then we can create interpersonal peace between us, between a couple of us, and we can create social peace between a bunch of us, which we're doing right now, by the way. Congratulations. We are socially peaceful right this minute in this room or in this Zoom. So we're doing it right now, and we're hopefully leading toward EQ for peace. I mean, we're leading toward global peace if we get this right. So we're starting with inner peace. We'll start with inner peace, and inner peace starts with emotional intelligence and positive mental health. That's how we get there. Peace is the goal. All right. So what's positive mental health? It's basically, as you probably know, mental health has a kind of negative connotation to it. So we are saying there's a positive side of that, because like positive psychology, you probably heard about, positive psychology said we can go from, they used to just go from problems, issues, pain, up to back to normal, a lack of problems and issues and pain, right? From negative to zero. And positive psychology said, no, we can do better than that. We can go higher. We can study the people that are doing very well and learn how to do better, not just normal, not just function, not just survive, but thrive. So positive mental health, same thing. We can deal with our negative issues, our problems, our pain, our anger, our sadness, all depression, stress, anxiety, all that stuff. We can work with those and deal with those. And as we deal with them, we can keep going. We can keep going and learn love and peace and joy and happiness and success and some resilience and perseverance and grit. It's one of my favorite. Grit. That means this is going to be really hard, but I can do it. I can do it. So we can do better. So that's my point, is that we can go down, learn how to go down so that we can go up and stay up. We're still going to have negatives, but we can learn how to deal with them. Oh, here we go. So learn how to go down and deal with our negative emotions, which I'm going to talk about, and for the purpose of going up, right? It's pretty cool. So some minor benefits, being sarcastic, of these are that it helps us respond rather than react to life. And I'll talk about that in a minute. It gives us control over our lives. I should have put that real big in the top, because that is the biggest thing, is that we then become in control of our own lives. That's a big deal, as opposed to they did it to me, the pandemic did it, the government did it, my parents did it, my students did it, whatever, the school, whatever it is that did it to me. No, we do it. We are in charge of what goes on inside of us. And that is a beautiful thing. That was a life changer for me. That's why I'm here right now. So it's a big deal. It gives us choices. When we are in control, we have choices, we have freedom, we have personal power, we can love, we can open up our hearts or close up our heart if it's not safe, but we can open our hearts on purpose by ourselves. It's a beautiful thing, skill that we can learn. Again, no cost whatsoever. Just learn how to open yourself and close yourself. It's really cool. So we can create love and intimacy that way. We can allow love to come out. We can allow love to come in. And we can be very, very close and get the obvious benefits of all of that. It just feels fantastic. One of the better feelings in life. We can feel alive. We can get better results. We can be more successful. We can lead. We can, if we choose, but we can lead our own selves. We had a speaker the other day that said they were talking about inner leadership versus outer leadership, which is pretty cool. We can lead our own lives. We can manage ourselves. We can manage our career. We can manage our relationships. We can manage ourselves. And that's a fantastic thing to, we're not a victim. We are in charge of our own lives. That's a big deal. We could get self-esteem, we could care and nurture ourselves and love ourselves, which is pretty cool, right? If you're going to start loving others, you might want to start with you. It's very, very helpful. So so we can be more successful. We can take care of ourselves. We can have a purpose for living, which is another wonderful thing. I have a very strong purpose. I wish you that you could have the strength of purpose that I have. And you do that by choosing. You just choose what's right. I think that I'm supposed to be here teaching you guys and teaching everybody how to do emotional intelligence and positive mental health. So that's what I'm doing, and it feels fantastic. I wish for everybody that they would have what we call a noble goal, where something bigger than you that you're involved in, kind of like this workshop. Actually, Dr. Ravindra's doing it right now. He's making a difference by putting this on. It's pretty neat. And so you too you don't have to put on workshops, but something, be involved in something bigger than you that's making a difference, that has you jump out of bed in the morning. And you're like, oh no, I got stuff to do. I'm important. Let's go. So, we can create better teams and families and relationships and change our culture. Maybe our culture and your culture both are against emotions, kind of. They are squashed down and ignored, and we don't talk about them, but we need to deal with them, and we need to feel. We need to take into account our emotions as well as our thoughts, which I'll go into, and we can change things. We don't have to go specifically by what we should do and what we were told to do. We don't necessarily have to do that. We can do better, in my opinion. And we can heal. And this is one of my specialties, is that we work with our past and heal some of the pain and anger and sadness and stuff that's inside of us from our childhood often. And we carry it around with us, and we don't have to carry it around. It's really, really good news. We don't have to carry our pain with us. We can release it. And I'll help you figure out how as we go along. So you get the idea. It's kind of important. Obviously, I'm pretty sold on it. I hope you are too. It's huge. So what is it? It's just about being smarter. It's just about being smarter with our insides. We don't learn this stuff in school. And so we got to figure it out on our own, so we can be smarter about ourselves. It's about understanding and managing our inner world. And the way that looks is there's a couple of components to it. Thoughts. I'm pointing because it's our left brain. I'll get to that in a second. We have thoughts. We have feelings. Not just thoughts, right? A lot of us focus on our school and our work and our homes, usually focus on our thoughts, but we have feelings too, and you can't stop them. They're happening whether you like it or not. They are happening. So let's get good at both of those, shall we? 24/7, 365, most practical subject there is, in my opinion. This is because it doesn't stop ever until we're done. They don't stop. So we should get really good at figuring out what's happening inside of us and being able to manage it and enjoy it. Oh. So thoughts, feelings come together. We then make decisions based on our thoughts and our feelings, hint, hint. We make decisions on those, and then we take actions on those. And of course, the actions are what gets us our results. And that's how we do our relationships and all that good stuff. But it starts inside with our thoughts and our feelings and our decisions. And our decisions are where we have the power to not just react to things, but respond. Respond means, okay, give me a second. I'm going to take this into account, and then I can do better. I can respond better. So respond rather than react. I was just saying. So reacting is habitual, automatic, not much consideration. We're just reacting, right? Or we're intentional and purposeful, and we use our wisdom to respond the way we want to, that puts us in control. All right. Reacting is just, we're still in control, but it's too fast and too non-intentional, and we want it to be intentional. And so even if we choose not to act, that's our choice, and that it can be intentional, right? So 6seconds.org. You might check them out. They have the most amazing trainings, assessments, curriculum, concepts, all kind of articles, all that stuff on emotional intelligence, most of which is free. 6seconds.org. They call it 6 seconds because physically, when we have a strong feeling, it goes, and it takes about 6 seconds. You know how like when you count to 10 before you react to something? It's kind of like that. It takes 6 seconds scientifically for our body to process these huge emotions and settle down. So if we give ourselves just a couple seconds to respond rather than react, then we can do better. We can do much better. People drive peace. Peace, motions drive people. So that's why we're talking about this. So if we don't do this, here's what's happening. If we don't do this, because we don't have emotional intelligence mostly in the world, it's leading to all kinds of social problems. I suggest that the lack of emotional education is the second biggest problem in the world today. It's my opinion. Of course, it's just an opinion. Which is a thought, not a feeling. It becomes a feeling, but it's a thought. Okay, we got to differentiate those. So man, so many bad things are happening because people don't know how to deal with their emotions, and like violence and abuse and addictions. That's a great one. Addictions are totally emotion based, right? Totally emotion based. And then the worst one of all, of course, is suicide. And I don't know if you guys know about how bad things are suicide wise, but it's skyrocketing in Asia and in Africa and in Europe and in the United States and all over. Suicide is up with the pandemic, and because things are so hard and so painful, and prices are skyrocketing, and it's just suicide is going way up, and that is the ultimate in not being able to deal with your emotions and your thoughts. People are left by themselves and they're disconnected now, and that's not good for us humans. Us humans want to be connected. We want to be connected, and we need to be connected, and if we're not, it's ouch. big ouch. And people, so much so that people and kids even are going, I can't do this. That's another thing we tell ourselves, I can't do this. And of course you can, but we tell ourselves I can't do this, and so I'm out of here, and it is your decision. But so divorce, mental health issues, of course, and scientifically found now that if you don't deal with your emotions for over a long period of time, your body starts shutting down. Your body gets affected by it. It changes the way your blood system works. It changes how your heart works. It changes how you breathe. It changes all kinds of things because you're not dealing with your emotions. And eventually that becomes physical health problems. And so they've directly related not dealing with your emotions with getting severe physical ailments as an adult. So of course, crime and then war, the opposite of peace, because people don't know how to be peaceful, so we go to war. Incredible. So we don't learn this stuff from our parents. We didn't learn it from school. It's just now starting to be taught in your schools and ours both, which is fantastic, wonderful. And so, but we got a long way to go. We have a long way to go. I just think it's wrong that this is not taught to all kids all the time. Even little kids can understand that it's not very complicated. You know, if you're really sad, let yourself cry and you'll feel much better. And your body goes, thank you, right? You don't have to carry around sadness and anger and fear and stuff like that in our body. Our body does not like it. Its body doesn't want us to carry it around. And so we as an adult have to manage ourselves and allow ourselves to feel and let some of that garbage out of us. And our body's like, thank you. I don't want to carry that around. Thank you. You will thank you for it. But we don't learn about that in schools. I was very disappointed with my education. I went all the way through college and they ended up going, is that it? Is that it? that's it. I found out all this good left brain interesting things so I could get a job. But what about me? I don't know how to manage me. And it didn't go very well after that until I figured out that it's mostly because I was completely clueless regarding my thoughts and emotions, especially my emotions. My parents didn't know. My dad was in the military in the United States Air Force. We moved all the time, and he was told, don't deal with your emotions. They are made not to deal with the feelings, right? In the military, you have to, don't feel, do, go, take your orders, go. And so of course that funnels down to the kids, and the kids going, well, how am I supposed to do this? And it's like, I don't know. We were told not to, so I don't know how to do it. And I asked my dad that, and he said, basically, I wouldn't know an emotion if it slapped me upside the head, which is funny, but it's not. So we don't learn in school. Our parents didn't teach us, not because they were mean. Some parents are mean, but most of them are not. And they want the best for their kids, but they don't know. So how am I supposed to teach you something I don't know? I can't, right? So and we better not deal with stuff at work. So we have to figure it out on our own, and that's not cool. Aristotle said, educating the mind without educating the heart is no education at all. Well, that's a little bit severe, but you get the idea. We got to do our heart as well. This is what happens if we don't, or this is how it can stop. We can stop this. So a lot of times it's passed down, negative. This guy in the middle said, no, wait a minute. I am not passing that on to my kids, even though I don't necessarily know how to do it. I need to do this differently. And so he's stopping it, changing it. I'm not treating my son this way. And look what happens. He then doesn't treat his son that way, and he do it different. So you can do this as well. I love it. And I have 2 new grandkids. We have a 9-month-old and a 3-year-old granddaughters, both of them, and they're the most incredible people. They're such wonderful, loving, incredible people because our daughter grew up with being emotionally intelligent with us. So so she's not passing on some of the garbage, and she's a wonderful, wonderful mom. So change it, please. This is about studying ourselves, we call it a meta study or meta analysis. It's us looking at us looking at each other, and us figuring out how to get along, how to work together. We call it metacognition, which is thinking about what we're thinking about and feeling about what we're feeling about, a meta emotion. So it's us working on us. Best news, if we work on us and we learn how to understand and control ourselves, guess what? We are in control of our lives, and that is a beautiful thing. Powerlessness is one of the worst things around, in my opinion. It contributes to so many negatives. Is that I can't do anything about this. That thought that I'm not in control, somebody else is, and I can't do anything about it, and that starts heading downhill pretty quickly. So this gives us power and control. One thing, though, there's one thing that is really, really critical to this whole thing. If you don't take anything from this talk, please do this. This one thing is you take emotional responsibility, accept emotional responsibility, which means that your thoughts, your feelings, your decisions, your actions, your values, your belief systems, your attitudes, all that stuff is yours. Take ownership of yourself, and you can do great things. If you don't, it doesn't go well. It doesn't go well. If you think they did it to me, if you think they're doing it to you, and that stuff is happening and you're out of control, then that's no fun, right? That doesn't feel good, and it goes downhill from there. But this seems to be the tipping point, is taking responsibility for yourself. And it's not some of your thoughts, it's not some of your emotions, all of them, they're yours. Please take ownership of that, to make a decision right now from the rest of your life, and go. You could do amazing things, but it's not always fun, like I say, it ain't always fun, but it's got to get done. It's not fun stuff. Sometimes it's incredibly uncomfortable. Sometimes it's painful, but it is the only way to go. It's the only way to go. And it drives, if we can take responsibility, then we can learn to trust ourselves, and we can learn to understand that we are in charge, and we are okay with that. Knowing that I'm in charge of me is a beautiful, freeing, wonderful thing, in my opinion. You can be a blamer, whiner, victim if you want to, but I suggest you don't. So this is just a fun slide. Left brain, right brain, I was talking about. We are brain split in two areas. There, of course, two hemispheres. Of course, this is not super accurate. It's just a fun slide. Most of the stuff, there's amygdala and the prefrontal cortex and that sort of thing that are kind of in the middle, in the back, and it doesn't matter. You get the idea. Mostly we focus on our left brain, and our logic and our logic, and we need to focus also not instead of also on our right brain, which is much more fun, and where our passion and our creativity and our senses are, our touch, feel, hearing, sound, all that kind of stuff is all in your right brain. So this right brain stuff, we need to add them together. Balance is the key. Balance, both of them, not just one, both of them. So example, this is the guy, this guy on the left, he's good at IQ and he's not too good at EQ, and do it like this. And, but if he was to increase his EQ, then he has balance and then he can fly, right? The guy on the left's going to spin around and crash. So balance. Some people say one's more important than the other. I disagree. There are times when we make decision to make a logical decision and put our feelings less important. There's times where we make our emotions more important and our logic a little less important, but being off balance doesn't usually work very well. All right. The way that looks is we ask ourselves, when we're making a decision, does this make sense logically? Does it make sense? We're using our thoughts. And does it feel good and feel right? Does it make sense and feel right? That is taking both sides of your brain, their thoughts and your feelings, into account. And then you make decisions based on both sides. Try it. It's very important. The good news is, if we don't like the way we think or feel, if we don't like it, we can change it. We can change them. That's emotional intelligence. That's power. That's personal power, in my opinion. That is the ultimate personal power, is that if I don't like what's going on inside of me, or I might like it very much, but it's not working for me, like addictions and stuff like that, where there really feels good, but it doesn't make any sense whatsoever. We can change that. We can adjust things inside of us. We can do it different. So we can change it. Again, puts me in control of my life. Happy thing. Makes me very happy. So I'm afraid I'm running out of time, but let me go real quickly through some of these. It starts with self-awareness. Everything starts with you being aware of you. Then you managing you. Once you're aware of you and you accept you, then you manage you. Then you find out that your thoughts and feelings are really important to you. And then you find out that they're really important to other people too. And so we can be socially aware by understanding and accepting other people's thoughts and feelings. And they like that, which means that it can improve all your relationships that way. So check that out. And lastly, responsible decision making, which is taking into account both sides of our brain, our left brain and our right brain, our thoughts and our feelings. Making decisions based on both of them is a wonderful thing. So emotions matter very much. We are born with, this is not stuff we're stuck with or born with. We're only born with a couple of fears and no anger. So that means all your fears and all your anger and all your sadness are learned. You picked them up along the way. There's stuff you decided, how you observe things and took them in, and your point of view, whatever, and you can change that. You can change all of it because you made it. You can undo it. You did it. You can undo it. You learned it. You can unlearn it. It's pretty cool. So again, putting you back in control of your life. And it's even better than that. Better news is that we are born really positive. Like my granddaughters are just, wow. When they first came out, I was watching them because I teach this stuff and I'm watching them carefully, and they're very happy. They were totally peaceful. They're very even loving when they first came out. Very right from the beginning, they're fine. And then when something's not fine, they express that when they are hungry or tired or need a diaper change or whatever. They're not happy for a minute, and they say so. They express that beautifully, and then when their needs get met, they go right back to their natural state, which is positive and loving and happy and peaceful. It's peaceful. That's our natural state. So all we have to do, again, simple, not easy. All we have to do is remove our negatives, and we naturally come back to our positives. Magical, kind of magical. Actually kind of is. So it's really helpful to have a really good vocabulary of feelings, so we can describe stuff in depth to ourselves and to others. But it's also really helpful to break it down, summarize it. Fear, anger, sadness. Those are the big three, in my opinion. You can feel more than one at a time, but if you can deal with your fear, your anger, and your sadness, then those big three, at the extent that your body feels them, you can there just isn't that much that life can throw at you that you can't handle. You can handle anything if you can handle those big three, in my opinion. And that's working well for me and a bunch of other people. So get good at your fear and your anger and your sadness. Quit denying them to yourself. Understand what's going on inside of you. Listen to you and deal with them properly, and you will trust yourself. You will feel personal power. You will feel grounded. You will feel peaceful and loving. Joy, peace, and love. They come right behind those other three, if we can deal with the other three. The good news is, more good news, no matter what happens outside of us, we are in control of what happens inside of us. So inner peace comes from the moment you choose not to allow another person or event to control your emotions, which is back to emotional responsibility. It's not them, it's me. They don't make me angry. I make me angry. More specifically, my thoughts make me feel angry. So awareness. Oh, yep, I'm having a feeling. Acceptance. Yep, I'm having a feeling, and now I can do something with it or not do something with it. Again, that puts me in control. So stuff happens, we then take it inside, we become aware of it, we accept it, we evaluate it, we make decisions on it, and then we go back outside by doing actions or no actions or no actions. No action is a good action a lot of times with strong emotions, for sure. And that is where we get our life results from. This kind of sums it up for us. Thoughts and feelings are inside, actions outside. And I'm trying to finish up here. Commit to yourself that emotions are more important than you thought they were, please, and take some account of your own. At least you don't have to tell anybody, you don't have to show them if you don't want to, but please take them into account for yourself. You will be amazed how much that changes things. Connect. That again, that is one of the biggest problems in the world today, is that people are totally disconnected. The lockdown and stuff has separated people. People are stuck, and that's not good for us humans. We don't function well if we're not connected. And the connection part is on you, baby. It's on you. They're not going to come to you. You got to reach out. You got to open up. You are going to have to connect on purpose. And I highly, highly suggest you do that, because some of the longest studies in history are showing that the number one thing is connection, is people connection and love and matters. And then create peace and love in your life. All right. So I'm going to skip down through these because I'm late now. So empathy, big thing. And you first. All right. Empathy, you first. And watch your thoughts. If you are having yucky feelings, check out the thoughts that are behind those feelings. Check out the thoughts. You can, this is PTSD or PTSD. You can have it be a disaster, or you can have even your trauma, even pain can be educational, and you can come better because of it. So awareness, acceptance, action. Recap: awareness, acceptance, action. Take emotional responsibility, please. It will change everything for you. Live it, love it, teach it, model it, please, and share with other people because they don't know. So jump to the last slide, which is you can connect with us with our nonprofit. We're trying to do great things and we're happy to share it. And so sign up and connect with us. It's called eq4peace.org. So, all right. All right. I'm only 3 minutes late. That's pretty good. So thanks for having me. This was great. I appreciate it. I hope that was helpful for you guys.
Thank you. Thank you very much for the insightful session.
Great.
Manage time well within your time slot. Thank you for that. I know it is very difficult, but still able to manage it. Congratulations.
Yep.
Thank
All right.
you for joining us on this.
All right. I did. Very good. Thank you guys again for having me. I have another meeting I got to go to. So I appreciate being here. Happy Mental Health Day, and take your emotions into account because they matter. Okay. Balance them. All right. Bye all. Take care. Contact me if you want. I'll put my my email in the chat. Boom. Bye.
Thank you, Matt, for once again joining us today. Any queries, you can put it through feedback form because we are running out of time. We'll take up queries at the end of the session, or you can use feedback form to put in your queries, comments, clarifications. Now, let's move to our next speaker for the day. We have with us Srimati Divya Bharati. She is nurse and counseling psychologist. Over to you, Divya, for session on concept of health and disease.
Thank you.
Kindly switch on your audio, video, and also share your PPT.
Yes, sir.
Yeah, it's visible.
Yes, sir. Thank you. Thank you very much, sir. Very eminent speakers. They told very well said, sir. But I learned a lot from previous sessions. And good evening, everyone. I would like to share with you today about concept of health and disease. So, what is concept of health? So, I would like to share with you about the concept of health. I would like to talk more details about the concept of health. So, health is a continuous to be neglected entity. So, we are why this is neglected means it is by lip service will be doing on. So here, what we are doing, just we are uh, sharing ideas like this, you have to take care about your health. So what exactly has to take care, that never, no one will tell exactly about this. And the following steps also, that may be difficult for us to uh, put on that steps. So here at the individual level, it can be said that health occupies an important place. It is usually subjugated to other needs defined as more important, as well as wealth, power, prestige, knowledge, and security. Health is often taken for granted, and its values is not fully understood until it is lost. So, when we lost our health only, we can realize that health is very important for every person. And today, behalf of the World Health Day 2022, the theme is our planet, our health. So, among the biggest health threat that humanity faces during this pandemic are climate crisis and the burden of a polluted planet and increased chronic diseases like cancer, asthma, and heart diseases. So, we are the people, we suffered a lot during COVID pandemic uh, period. So here in the on the earth, according to researchers said that there is only 90% of oxygen is present on the earth for an individual. So we are not getting 100% of oxygen. We only get a 90% of oxygen. And current health issues. So in the current scenario, there is so many health issues will be there. Um, First, there is step by step. I listed some issues. So that is physical activity and nutrition. So physical activity is lacking. There is lacking of nutrition. Due to that, what will be happening for the human being? There is a risk of diabetes, hypertension diseases, and cancers, and vision, hearing problems, and infections, and nutritional imbalances, and renal failures. And due to overweight and obesity, there will be hypertension, coronary heart diseases, stroke, gallbladder disease, osteoarthritis, sleep apnea, and dyslipidemia, means the lipid count will be increased in the uh, arteries, and sleep apnea, and breast, prostate, and colon cancer, and respiratory problems. And tobacco, consume of tobacco, there is some issues like cancer will come. So smoking kills, we know. Even people, they are not avoiding tobacco. And substance abuse. So due to intake of drugs, there is harm to health. And HIV and AIDS. So here HIV AIDS. So here immunity will be decreasing. So it is also called as a slim disease. So due to decreasing of immunity, there is easily a frequent attack of illnesses. And mental health. So in mental health, there is increasing of suicide, depression, and dementia will be increased nowadays. And injury and violence. So we know that domestic violence uh, very very highly takes place during COVID pandemic time. And there is risk of falls, breaks, and burns. And the environmental quality. So there is the environmental quality is decreased. We know that. So and due to that, there is low income, racial and ethnic minorities will get migrated and increased. And immunization, due to immunization and lack of immunity, there is very easily getting influenza virus and pneumonia. And access to healthcare. So accessibility should be required for each and every individual. So especially for elders, so many health issues arising during their lifespan of old age. So there is medical supervision will be required for them at a community and at community level. So so for in rural and urban areas, there is the availability is required much. And there is the older age people, they are having hypertension, diabetes, and gynecological issues will be there, and frequent falls will be there. So for these and all things uh, emerged nowadays. And coming to concepts of health, so there is four concepts will be there. So according to uh, according to different people, different professionals, they said perceive health as different point of view. So there is biomedical scientists and social science specialists, health administrators, ecologists. So they are given their own uh, perceive of the health in different way. Coming to first one, biomedical concept. So in biomedical concept, there is traditionally health has been viewed as an absence of disease, and if one was free from disease, then the person was considered healthy. This concept known as the biomedical concept, so has the basis in the germ theory of disease. So in germ theory of disease, they are telling that, so here absence of disease is called as health. So the medical professional viewed the human body as a machine. If a body is like a machine, then for a machine service is required. For that, where we are taking that machine to the service center. Like human body also requires some services. If disease is attacked, then we are visiting the doctor and repair our machine. So in biomedical concept, some criticisms will be arised. Why? Because there is a focus focus is on only biological point of view. So here there is minimize the role of environmental, social, psychological, and cultural determinants of health. There minimized the that focus. So inadequate to solve some of the major health problems of mankind. Example, malnutrition, chronic diseases, accidents, drug abuse, mental illness, environmental pollution, population explosion. So due to these criticisms, other uh, theory arised. So here, one example. So when a doctor, what will do? He will when we visiting a doctor, what he will do? He will ask the signs and symptoms. What happened to you? So by that signs and symptoms, he suspected that particular individual have certain issue. So by how he can do diagnosing, by doing scanning, by X-rays, blood test, ultrasound, mammography, pap smear test. So due to these tests, he diagnosed that certain individual is entered into this disease. So by that, after diagnosing that, what he will do a treatment. So he will refer to any action that is taken to improve the health of the person, and giving giving interventions to that disease. So in biological concept, they are talking about this much only. So next concept is ecological concept. So in ecological point of view, what they told that, so there is health as a dynamic equilibrium between man and his environment, and disease, a maladjustment of the human organism to environment. So here Dubos said that health implies the relative absence of pain and discomfort, and a continuous adaptation and adjustment to the environment to ensure optimal function. And one more thing, it determines not only the occurrence of disease but also the availability of food and population explosion. So here they are talking about the food and population explosion also. So here this concept is raises two issues. That is, first one is imperfect man, second one is imperfect environment. And history argues strongly that improvement in human adaptation to natural environments can lead to longer life expectancies and a better quality of life, even in the absence of modern health delivery services. So in ecological health, there is plant health, animal health, human health. All they are talk uh, about that health. Next is psychosocial concept. So in psychosocial concept, they revealed that not only biomedical phenomena, there is social, psychological, cultural, and economical and political factors also they are including this. So the factors must be taken into consideration in defining and measuring health. So thus health is both a biological and a social phenomenon. So here you saw in this diagram, there is biological, social, and psychological. Both are togetherly, they are talk in this psychosocial phenomenon. So in biological, what they are focused means their drug effect, age, genetic factors, nociception, comorbidity, severity of diseases. They are talk about it. Nociceptive means there is perception of a sensation of pain. So, and in social concept, what they're talking, social support, economical factors, cultural beliefs, work situation, social environment, activities of daily living. And in psychological concept, expectations, cognition, mood and affect, catastrophizing, stress and coping. So, these all together called as psychosocial concept. So next coming to holistic concept. So in holistic concept means holistically means whatever they are not focused a certain area, but that so in not talked in the ecological concept, biomedical concept and psychosocial concept. So that holistic concept came arise. And here they are talking about the social, economical, political, environmental influences on health. So how these influences come under our health. And health implies a sound mind in a sound body, in a sound family, sound environment. So not only in the body, not only in the mind, our family should be sound, our environment should be sound. Then only it is called as health. So the holistic approaches implies that all sectors of society have an effect on health. In particular, agricultural, animal husbandry, food industry, education, housing, public works, communication, and other sectors. The emphasis on the promotion and protection of health. So completely all together they talked in holistic health. So in this the main areas focused we talked about physical, mental, emotional, social, and spiritual. So what is physical health means what healthy diet, exercise, absence of illness, controlled AOD use. AOD means always on display. So we are always using gadgets and all. So that should be that limited the time of that, and we should control ourselves. And the mental and cognitive area. In this area, what we are focusing means engaging in meaningful work, keeping up to date to current affairs, and being a lifelong learner. And emotional well-being, in this what we are focusing means positive thinking, emotional regulation and expression, coping strategies, and resilience. And social, on this area, support networks, that is making and maintaining meaningful relationships, sense of belonging to a community and clubs, and contributing to society. And coming to spirituality, in spirituality area, spiritual what we are focusing means a sense of meaning of purpose in life, having a set of values and ethics, feeling connected to a higher power and nature, feeling a sense of peace or transcendence. So what is health definition? So here there is different scientists, they given different definitions. Uh, so here the condition of being sound in body, mind or spirit, especially freedom from physical disease or pain, that is called as health according to Webster. According to Perkins, what he said, a state of relative equilibrium of body form and function which results from its a successful dynamic adjustment to forces tending to disturb it. It is not passive interplay between body substance and forces impinging upon it, but an active response of body forces working toward readjustment. And the World Health Organization given one definition that we all are know. What they said means health is a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. So here, what means in WHO definition, there is a focus on all areas: physical, mental, social well-being. So here, if we are talking about these dimensions, there is in everyday life, it is not possible for no one to become a healthy person. So that is perfect biological, psychological, and social functioning should be there. Means, is it possible for us? No. So if we follow the WHO definition, we are all sick. So there is so for to avoid this, so some operational definitions given. So WHO definition of health is not an operational definition. So that is, it does not lend itself to direct measurement. Studies of epidemiology of health have been hampered because of our inability to measure health and well-being directly. So in this connection, an operational definition has been devised by a WHO study group. So in this definition, the concept of health is viewed as being of two orders. First one, a broad sense and narrow sense. If we think in a broad sense, health can be seen as a condition or quality of human organism expressing the adequate functioning of the organism in given condition, genetic or environmental. In narrow sense, if we are talking, means there is no obvious evidence of disease and that a person is functioning normally. Several organs of the body are functioning adequately in themselves and in relation to one another, which implies a kind of equilibrium or homeostasis. And there is new philosophy of health. So what are those philosophies? Means, health is a fundamental human right, and health is the essence of productive life and not the result of ever increasing expenditure on medical care. Health is intersectoral. Health is an integral part of development. Health is central to the concept of quality of life. Health involves individuals' state and international responsibility. Health and its maintenance is a major social investment. Health is worldwide social goal. So these are the new philosophy of health. Coming to the dimensions of health. So there is health is a multidimensional. So we talk previously in concepts. There is so many physical, mental, social. We talked. So here we are going to know about one by one what are those. So so here in WHO definition there is only physical, mental, social is there. So there is not only that, there is emotional, spiritual, occasional, political, philosophical, cultural, socio-economic, environmental, educational, nutritional, curative, and preventive. So these many areas will be there. So for a individual, we have to focus on these areas, then only we will become a perfect person. And there is a 7 dimensions of health you are looking on the screen. So there is a physical, occupational, intellectual, emotional, spiritual, social, and environmental. So first dimension is physical dimension. So in physical dimension, views health from physiological perspective only. So physiological only we are focus here. So it conceptualizes health that as biologically a state in which each and every organ, even a cell, is functioning at their optimum capacity and in perfect harmony with the rest of body. So each cell, so there is a complete human body is made up of so many million trillions of cells. So each cell functioning should be optimum. So that should be working completely healthy. Then only that is called as health. So physical health can be assessed at community level by the measurement of morbidity and mortality rates. So morbidity means there is a disease rate. Mortality means a death rate. So at the community level, how many morbidity, mortality will be takes place due to physical illness, that will be assessed. That is physical dimension. And coming to the next, mental dimension. So here ability to think clearly and coherently. This deals with the sound socialization in communities. Mental health is a state of balance between the individual and the surrounding world, a state of harmony between oneself and others, coexistence between the relatives of the self and that of other people and that of the environment. So, mental health is not merely an absence of mental illness. And the features of mentally healthy person means a person who is called as mentally healthy means a mentally healthy person is free from internal conflict and well adjusted in the external environment, accept criticism, not easily upset, and searches for one's identity. Strong sense of self-esteem should be there and knows himself, what is his needs, what is his problems, what is his goals. So he is in the self-actualization state. He will reaching at most self-actualization state and have good self-control, balances rationally and emotionally, and faces problems and tries to solve them intelligently. So coping with the stress and anxiety, what come to his environment and his internal, he will easily coping all those stress and anxieties. Coming to the next dimension, that is social dimension. Social well-being implies harmony and integration within the individual, between uh, each individual and other members of society, and between each individual and the world, so in which they live. So here, individual and society, and individual and world. Then only then only the person is socially healthy. So it has been defined as the quantity and quality of an individual's interpersonal ties and the extent of involvement with the community. So the quantity means how many, quantity means how many he is interacting with, how many people. Quality means at, at the time of exposing, how much qualitatively he is interacting with the people. So that leads to a social healthy social, that person is called as socially healthy person. And the social dimension of health includes the level of social skills one possesses, social functioning, and the ability to see oneself as a member of a larger society. Main focus on positive material environment. So there is material means we are living in a materialistic world. So in social psychology, social point of view, they talking about material. So positive material environment, that is financially sound and residential matters. So where means our house, do we have own house, or do we where we are staying, any slums, so like that. So positive environment, a positive human environment. So positive human environment means social network of the individual, means how he is connected with the world, means in how many ways. So in social dimension there is main focus is on positive material environment and positive human environment. And coming to the spiritual dimension, in spiritual dimension, spiritual health has two dimensions. First one religious and second one is existential. Religious health means religious health is related to individuals' perception of their health in relation to a supreme power. So completely they are obeying the what religion they are belonging to, what sayings said by their religious uh, persons. They are obeying to them, and they are achieving the highest of supreme power. They are achieving that, grasping that power, try to adopting that. And existential health means here what they are talking means it is related to their socio mental preoccupations and their way of interacting with themselves, the society and the nature. So how their socio mental preoccupations will be working, so that should be in a positive way. So here in spiritual, we are talking here about spiritual health and spirituality. So there is two different words. Spiritual health means it is talking about objective. Spirituality means it is talking about subjective issues of an individual. So within the individual, he is he is highly he is doing prayers and all, and he is he is following the morals and ethics and about subjective issues. So he is adopting all those things, that is subjective matter. So what he is adopting, what he is doing, up to himself. And then spiritual health means that is objective in nature, means that we can observe. So by pupil we can observe all the persons how they are practicing their spirituality. And in spirituality, there is a person, we are means so many people thinking that spiritual dimension means only belonging to God. It is not only belonging to God, it is belonging to nature and society and the cosmic energy, whatever the we still don't know the there is no scientific reasons regarding black hole and all. So how it is forming, why it is forming, what will be inside. They are telling that some other world is also there inside the inside the black hole. If we go into the black hole, what will be happening? There is a high pressure will be there. Due to that high pressure, the human body will like a uh, sponge, like a sponge, it will be divided all the cells, and it will go inside and it will throw into the other world of outside. So there is telling that in the universe so many things will be there. So there is, we don't know the scientific reason why, because every time they are talking that this is the end of the world. So during COVID-19, so many mortality takes place. So everyone thinking that this is the end of the world. So it is not the end of the world. So always there is balancing will be there, from negative to positive, from good to bad. So everything balancedly, the nature and nurture will be going on. So that we have to think about this. So here in spiritual in spirituality, it includes integrity, principle and ethics, the purpose of life, commitment to some higher being, belief in the concepts that are not subject to state of art explanation. So these are the uh, uh, things we are focusing in spiritual dimension. Coming to the next concept of disease. Till now we saw about the concept of health. So there is different dimensions and concepts we talked. Now coming to the concept of disease. So here there is different definitions will be there. According to Webster, what he said, a condition in which body uh, health is impaired, a departure from a state of health, an alteration of the human body interrupting the performance of vital functions. So he said that when body health is impaired, then only then it is called as disease. So the vital functions are the vital functions whatever will be there in our body, that performance will be interrupting and decreased. So what are the vital functions? Breathing, heart functioning. So means it is not in our control. If we are sleeping or if we are doing work, our breathing will not stop, our blood circulation will not stop. So these vital functions are continuously it will do. So there is, what is a coronary heart disease? Means when the artery is blocked, certain amount of lipid will be go inside that artery or vein, and that will be artery that will be blocking. So that is called as coronary heart disease. So so there is what happening, interruption will be came. So the complete function, what is the heart function? Circulation of the blood all over the body. So what will be happening here? Interruption will be there. So due to that interruption, what will be happening, the optimal functioning of the individual will be interrupted. So Webster talked about this, and according to the Oxford English Dictionary, what they talk means a condition of the body or some part of organ of the body in which its functions are disrupted or deranged. So some part of the organs will be getting disturbed, functions will be disrupted. So that is called as disease. Ecological point of view, what they talked means a maladjustment of the human organism to the environment. So the human organism, certain individual not able to adjust to the environment, that is called as disease. And sociological point of view, what they talked means disease is considered a social phenomenon occurring in all societies and defined and fought in terms of the particular cultural forces prevalent in the society. So sociological point of view means they are talking about social phenomenon. So all societies, mm, so there is a certain cultural practices will be there. So that cultural force is prevalent in the society. So in WHO, World Health Organization given health definition, but it is not defined the disease definition. So that is why there is so many uh, shades will came. So there is ranging from there is means spectrum of disease and subclinical. So there is cases to severe manifestation of illnesses. So by the we talked in subclinical means by the signs and symptoms we tell that subclinical, and different shades. There is spectrum of diseases. So these all are different concepts. So due to the not giving WHO not given the disease definition. So there is arising so many shades. What are those? Here I listed some things. I would like diseases commence acutely. Means acutely means onset coming suddenly. So due to, for example, a person got food poisoning or any appendicitis, onsetly acute appendicitis. So there is onset is sudden. So that is called as disease. Then some insidiously. So means here mental illness and rheumatoid arthritis will like these diseases will come insidiously, and some individual in carrier state means in carrier state the people will not show the signs and symptoms, but they spread the disease to some other person. For example, typhoid fever, and we know that COVID-19. Uh, we so many people are act as a carrier, and they passed the disease to some other people like that. So our world is suffered due to that disease. So that is carrier state. If carrier state also, it is a state of disease. Some organisms cause more than one clinical manifestation. Means one organism showing so many clinical manifestation, means signs and symptoms, it will show so many clinical manifestations. That is, for example, streptococcus, one of the organism that will cause it is called as meningitis, like that. So it will cause in some other blood infection, uh, then it will cause related to heart issues. So like this, one organism causes many signs and symptoms, and same disease caused by more than one organism. So, for example, diarrhea. So, diarrhea, the arising of diarrhea is only not only one organism. Due to different organisms, the person will get diarrhea, and then some
Any problem, ma, Divya?
Yes, sir. Unexpectedly it stopped, sir.
So,
Can I continue, sir?
yeah, please go ahead.
Yes. So where we stop then? So some diseases has short duration, some diseases has a prolonged course. So due means that is a disease state, and it is easy to determine illness by signs and symptoms. But many diseases, the borderline between normal and abnormal is distinct, as in the case of diabetes and hypertension and mental illness. So there is easy to determine there is some disease that certain individual has certain disease, but the distinction between normal abnormal, how it will be, that is will be different in different diseases. For example, in diabetes, type 1 type 2 diabetes will be there. In hypertension also, there is blood levels will be there. See, systolic and diastolic pressures will be there, low bp, high bp, so like this. So that normal and abnormal variations will be there. According, that is called as, means even little more abnormal, little variation from normal is also called as disease. And certain individual having the uh, variations means once in a lifetime, once for example, gestational diabetes mellitus is there. Means gestational means during pregnancy time only they are underwent in diabetes. So that is a disease state. At that particular time span, they are suffering with that disease. So that is the thing. And the end point or final outcome of disease is variable, and recovery, there is recovery will be there, or it may lead to disability, or it may lead to death of the host. So a person who is getting become, means the person who the organism which is entered into our body is a host to that organism. So that organism will uh, made us to disability or made us to death. So this is the different shades of diseases. And coming to next one, distinction between disease, illness, and a sickness. So what is illness? What is disease? What is sickness? Illness means that is first person perspective. So I underwent any disease, for example, fever. So that is illness. Disease, who will tell professional perspective? Professional means a doctor tell that he is underwent certain particular disease. And sickness means societal perspective, means people will talk about that person has some health issue XYZ, like some person has COVID, some person has AIDS. So the society is telling that a societal perspective is called as sickness. So here illness, a person experiences a loss. Example symptoms, uh, so here a person experiences a loss of his or her health. So he is lost his health. So he has certain symptoms, clinical symptoms will be there, like headache, um, or any other thing will be there. Fever will be there, headache will be there, or uneasy will be there, numbness will be there, nervousness will be there. So that the symptoms will be perceived himself. That is illness. And disease. Disease means the person calls for professional help, and his or her condition is diagnosed by a medical expert, that is physician. If certain physician is diagnosed that this person is having so and so disease, that is diagnosed by a professional, that is called as disease. And sickness here, the person takes and is given the social role regarding his or her condition. So his condition, he is talking with the society. I'm diabetic. I'm I'm having hypertension. So like this, that sickness we are talking with society, that is called as sickness. So here disease. Here we are talking about disease, sickness, illness. About this some 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 more extending. So here illness person's subjective experience of their symptoms, what the patient brings to the doctor. So the subjective experience, I mean, certain individual having certain signs and symptoms, he is going to the going near to the doctor, and he is telling that I have so and so uh, signs and symptoms. Do I have uh, any health issue? Means what is my health issue? He is asking, and he is going near to the doctor and concluding that. And sickness. In sickness, social and cultural conceptions of this condition. So here cultural beliefs and reactions such as fear or rejection, these affect how the patient reacts. Also covers what is considered a disorder suitable for medical treatment. So here you understand. So next, coming to disease. So here underlying pathology biologically defined. The practitioner's perspective, the illness seen in terms of a theory of disorder. So here means if a person having so and so issues, the clinical physician, what he do, he is diagnosing what is the pathology underlying, what is the uh, physiology undergoing in his body. He assessing each and everything, and he is diagnosed that certain individual underwent some disease. So that is, so this is about disease. Thank you very much for patient listening. Thank you, sir.
Thank you, Divya, for the insightful and detailed presentation on concept of disease. And also health. It was very insightful. Thank you for joining us. You can stop sharing, ma. It was a wonderful session. Thank you and wishing you all the success.
Thank you, sir.
We will move on to our next speaker because we are already ahead of schedule. So we have with us next Balaji Sundaram, Director Project Darshini from Vichinta Foundation, Hyderabad. We will be speaking on effects on environment, effects of environment on health.
Hi, friends.
Sir, you have 20
Audible?
minutes to conclude.
Pardon?
You have 20 minutes for your session.
Only 15 minutes only I need.
Oh, thank you for doing that.
Okay, don't worry. Just don't worry.
Thank you, sir. Welcome to you. Over to you.
Yeah. I just want to interact a minute with the participants, if at all they are interested in. How many participants are interested to interact?
We'll go on presentation mode. Interaction would not be possible because other speakers are waiting.
Acha, they are also waiting for it. Okay. So now there is a slight problem with my video. For a minute or so, I will be switching off the video. Okay, I will be speaking around. Okay.
Okay, fine.
Yeah. So friends, the total situation here is, what is the effect of environment on health? Health means I talk only about mental health. I am not interested in talking about other health, because there has been a very extensive coverage of that health. Okay. Now, what does the environment do to the body? Not the body, but actually to the system. It starts polluting your method of living, your style of living, your style of thinking, and also your association with people. This is what the whole problem is all about. I don't want to go further down on many issues because of paucity of time. There is a sound, a particular type of sound that could cure your stress, that could give you your peace. Do you know that? There is a particular sound, a kind of excessive sound, which can actually make you dizzy. It will make you confused. It will make you angry. It will not allow you to be there. If the whole environment is messy means kachada, then also you will not feel very, very comfortable, even if it is in your own home, to sit or stand. What does that do? It starts irritating you. Means the kachada, the environment creates a sort of emotional imbalance within your body. And this is exactly what I want to stress upon today. The emotional imbalance is not a proprietary organization of one person or one area or one particular identity. It is for everybody. Suppose, for example, I pollute the ocean with all toxic chemicals. Naturally, the ocean animals or the sea animals will eat it. What do? They sustain that residue within their body. What do? We take them out, cut, and eat again. Especially the heavy metals like arsenic or whatever it is. These toxic materials, if you are not controlling it properly, it goes back to the environment, doesn't go anywhere, but it will come back to your body. It will cause severe illness. Illness like dementia, Alzheimer's, or so many other things. And even your dizziness, even your body culture, even your BP levels are all a part of the system. Suppose you get addicted to I'm not feeling well today, I want to I want to have some fun. What do? You again go to another environment, which may not be your nature, but you want to have fun. You don't want to find out the reason for the problem, but you want the solution, which is a comfortable thing for that problem. This is your comfort zone gratification of self temporarily. What I mean to say, comfort zone gratification of self temporarily, which is very, very dangerous. Where do you go? You go to a pub, you go to a restaurant, you go to a friend's house, you go for a long drive and do whatever you want to do, you do. But one thing you will never do is you will never introspect. Introspection means what? Where exactly the problem started? Who is the creator of the problem? Is it me or is it somebody? Or which environment created this problem? Did I feel offended because somebody in the crowd was laughing at me? How often I see the crowd and laugh? In what way I will be related to that crowd again? These are all some very, very super logical questions. Those are very different from others' thinking process. Once you rationalize your thought process in this way, be rest assured that the environment in which you live will not, the human environment, I say, will not disturb you at all. The very sight of the other person is a disturbance to me. It is not the sight of the other person that is the disturbance. It is the impression that you have within you that creates that emotional confusion within you. So that's a very, very important thing for us to understand. This is about the human environment. Chalo, when we go to the external environment, there's a constant honking, there's a constant traveling on the road, there is a hell a lot of emotional, hell a lot of traffic problem that is there in the roads. Do you feel like driving? You feel, yeah, what nonsense driving is this? But you will never go back and say, today I will not use my car, I will use only a bus or a public transport so that my driving is reduced for a while and I'll have some peace of mind. No, I will not do that. I want my environment, but in my condition, in my area of thinking, in my area of understanding. So friends, there is a lot of things that the environment does. It pollutes. Every carbon dioxide that comes out of the system goes to your system indirectly. People say we are trying to inhale carbon, inhale oxygen, inhale the air along with carbon dioxide. We retain oxygen inside and we will only leave out carbon dioxide. This is what every textbook says. That is true. But the quality of oxygen that is retained inside, the unknown chemicals that are used in your fertilizers, the unknown chemicals that are used in your cool drinks and other things, where do they go? Where do they stay? What destruction it does to the body? And many of the times, the first affected thing is your emotion, your thyroid, and also your problems like sleeplessness, insomnia, or extreme amount of restlessness, frustration, anxiety, fear. These are all the problems that comes through. And for this, your basic problem of creating a peaceful environment for yourself should be the objective. Wherever you go to your office, yes, there are some good people, there are some bad people. There are some very, very cooperative people, there are non-cooperative people. Which is your priority? Choose your priority. You want to fight with the non-cooperative person always? Keep fighting. If that keeps you happy, no, it doesn't keep you happy at all. Only one thing I'll tell you. Suppose you don't like a person and you keep thinking about it. Suppose somebody shouts at you. Okay, let us not go into that. So let somebody shouts at you for some reason or the other. What happens? Immediately what you do is you will start thinking, "Arey, and what is the kind of problem that he has created upon us? And what kind of a problem that is being created on us?" That is what we think about for that moment of time. The fellow who shouted and left. But that particular shouting will be there in your mind for the whole day. You might have left that place, but that environment has not left your mind. So come on, eliminate those things. These are all the symbols which creates unrest to you, which makes you take artificial, I may say, relaxation processes, which includes taking of drugs, alcohol, etc., etc., etc. And these artificial satisfactory things will only increase and make you addictive of certain things, and where your wants will increase, your needs will increase, your resources may remain stable or even decrease sometimes. Then what do? Again, you have the same problem, right? And ultimately, there will be some thoughts of suicide also at times, which is also not right. So environment is not just a joke. Environment is definitely not just a joke. Just think. I'll give you only 2 examples to you today to make you think about it. 100 years ago, there were people living. Did they use pesticides? No. Did they use fertilizers? No. They used natural method of growing things. Today, people are canvassing for organic chemicals, organic products. Why? Pest control. Okay, accepted. I have invented pesticides. Yes, scientists were very proud about it. Did all the pests go and die? No. One pest goes, another pest comes. They have more resistance than you. So, there is a problem in our understanding. There are so many small things that we can avoid polluting the environment, which gives you a mental peace. And that mental health will provide you more thinking process, more resourceful areas of operation, and also a very, very important thing called peace of mind, which many of us don't have. Everybody is stressed. Everybody leads a stressful life. Everybody wants more money, more resources, etc. And they change their lifestyle. What they do? They buy everything ready-made and eat and things like that. That eating habits also creates a problem. See, your external facilities can be changed, but your internal functioning of stomach or liver or the intestine cannot be changed. If you are trying to forcefully alternate it, it will not produce enough resources within the body. And one of the most important resources that is produced within the body and goes to the mind, goes to the brain, is the blood and oxygen. Ladies and gentlemen, friends, this blood and oxygen is just not a joke. All the psychotherapy medicines which you get today only enables the passage of blood in a proper fashion in the neuron, increase the number of neurons, increase the systematic functioning of neurons, and all these things. And every drug has got its own side effects too. Now you want to live with a proper effect or unwanted side effect is your choice. I don't say anything about it. To me, a proper environment, whether it is a physical, a humane environment, or a food or intake environment, or the area in which we live, that is about the air pollution and the water pollution and those kind of environments, and also the association you have, the kind of thinking people you have. If you have right thinking people, you will always be bombarded with right solutions. But if you have a wrong thinking people and it's all over, you will always get wrong solutions to your mind. So this is very important, friends. Environment, yes, is one of the most important things to the mental health. Balanced and good environment is what we have to collectively create. Everybody is conversing for green energy, green environment, no plastic, no this inorganic substances, etc., etc. These were all in the past. Now it has come today. Lastly, before going, I'll give only one last example of Colgate. 40, 50 years ago when we were there, we saw the advertisement of Colgate. It used to show a rubbed glass, see what kind of a manjan you are using. Salt is only for food preparation, not for the toothpaste. You can't use a rough thing like a neem stick, but you have to start using the brush. Brush is nothing but the same neem stick that happens, but neem stick gives you a lot of chemicals, a lot of required chemicals that produce extreme amount of saliva, and that extreme amount of saliva is the balancing part of the acids that's produced in the stomach. Many people don't know this. And again, what does the Colgate does right now? It says Vedic Shakti. Vedic Shakti Colgate. What nonsense is this? 40 years ago, we were using the Farooqi Manjan or the Gopal Pallapudi or the Nanjan Good powder or some other powders that we had, neem stick, etc., etc., etc. The same thing is there right now also, but in a different fashion. We feel this is more modern and we have to encourage the modernness rather than appreciating our tradition. So friends, protecting environment has been our tradition for quite a long time. Vriksho Rakshati Rakshataha is what was told to us not now 5,000 years ago by our people, and the same thing is happening even today to help your emotional stability and the mental stability. Start protecting the environment, and at the same time, today I conclude saying that being World Health Day, your emotional health is more important than any other thing right now. So stay emotionally stable. May God be with you. Pray your prayers properly. Even that gives you meditation. That small prayer meditation also stabilizes your mind. So friends, I thank for the opportunity given to me today. And I think I have finished off my job in about 15-17 minutes as seconds. Thank you again.
Thank you, Balaji.
If you have any questions, you can always ask me.
Yeah. We'll take up at the end of the session because we are already running out of time.
No problem, no problem.
Thank you for
joining. They can always text you. They can always text you and get the clarification, whatever they need to at any given point of time. I will be replying. So need not worry about the time for question and answers. Please go ahead with your schedule. Thank you, boss.
Thank you. Participants can use a feedback form to share your queries, comments. We will share with the speakers. Now, we'll move on to our next speaker. Today, we have with us Edwin M. John, Director, Global Outreach, Neighborhood Community Network. So he would be talking on people health and people hand through neighborocracy. So we welcome you. Mr. Edwin John, can you unmute yourself? Switch on video and audio.
Okay.
Yeah, fine. We can see you, hear you.
Good. How much time is there?
Now, you can take about 20 minutes.
Okay, fine.
Thank you, because no, it's getting too late.
Okay, I understand.
Yeah, thank you. Over to you for your session. Thanks for joining us.
Yeah, that's it. Yeah. That's nice. Okay. So, my topic is people's health and people's hands through neighborocracy. And it has already been explained. Health is not merely the absence of disease, but a state of physical, mental, social, spiritual well-being, which is a fundamental human right. And this right is supposed to be for everybody. And government should be sued if this right is not ensured. But is it possible? And health requires not merely medicines and hospitals, but also good food, good water, good air, good environment, organic farming, good relationships, respectful treatment, respect for human rights, justice, peace, joy, etc. When all these things are there only, good legal systems, everything. When all these things are there only, people will have total well-being, physical, mental, social, and spiritual, which is a fundamental human right. Now the question, what is it that prevents the full enjoyment of this physical, social, mental, and spiritual well-being for many? We get people to discuss this problem. And then they come to two root problems. One, this is selfishness, another one, powerlessness. And then power is a crucial issue when it comes to health. Because who are all supposed to be most interested in their health? If not people themselves. And if people have power, they will see to it that they have all this physical, mental, social, and spiritual well-being. Now, what do you mean by power? Power means not to have an effective say. I say something, it happens, that means power. And people should have this power. If they should have this power, must have certain prerequisites. And one of the prerequisites for them to have their effective say, so as to ensure their total well-being, to have an effective say and to ensure that, then they need certain forums to come together, certain structures and so on. And this is what we are going to see. And then we go in a hurry today because we have only 20 minutes. Later on, when you have more questions, you can call me for another session to explain. Now I am just going to this dream of neighborocracy. It will look a bit far-fetched, but it's really right on the track, straight on the nail. And so it is going, so just follow me patiently for this dreaming. Just dream with me. So join us in dreaming big, dreaming of a new world. Dream of a world. As I told you, it look far-fetched, this political language, but there is really the real crucial issues there. Dream of a world where no direct elections to national parliaments take place, nor direct elections to state assemblies, not even to panchayat councils. Dream instead of a world where parliaments come to streets. This is the neighborocracy. I will explain how this fits in later. The whole world gets organized into neighborhood parliaments of about 30 neighboring families. Each neighborhood of 30 families becomes a kind of a mini world or a mini nation. Each neighborhood parliament has its neighborhood cabinet with a neighborhood prime minister and ministers for various concerns like health, hygiene, environment, income generation, children's welfare, adolescents guidance, and whatnot that are relevant at that level. Each neighborhood parliament chooses its delegates to represent them at the village parliament. It too has its village chief minister and village ministers for concerns that pertain at village level. Next come the third level parliaments, panchayat parliaments and their cabinets. Thus come about respectively block parliament, state parliament, national parliament, international regional parliament, and finally the world parliament. Then we say this structure of neighborhood parliaments and their multi-tier federation will be guided by some 5 principles. Principle number 1, the principle of smallness of size. It has to be small sized. Small sized means, the bigger a forum gets to be, the small voices get drowned. And then when the forum is small, any small person could articulate, express his concerns, and any small person is given attention. In a big forums like parliamentary constituencies that we are now, people don't have a face, don't have a name, and cannot have their voice. When they are voiceless, then they become powerless, and when they become powerless, their problems will not be adequately addressed. Then we say principle numerical uniformity. This again, I go very fast since there is more time. This is like this, we say principle smallness means the parliaments, not only at the neighborhood level, but at every level of federation above, like ward parliament, village parliament, at every level, it has to be small sized. Small means, everybody can sit around in one circle and nobody in the second row, nobody behind anybody else, and can talk without a microphone. And such a forum will give confidence to everybody. And everybody will feel empowered to talk to participate, to communicate, to advocate for their positions, etc. And then if you say it has to be small at every level, at first level, if it has to be small, it can have only so many families, 30 families. Next level, at ward level, it has to be small, it can have representatives from only so many first level, neighborhood level parliaments. Otherwise, it will not be, it will be too big. And that way, only so many neighborhood parliaments that are represented means it will represent only that much segment of the population. And third level also same way. If it has to be small, it can have representatives from only so many second levels. That means it can represent only that much segment of the population. So it goes like this. It has to be small. It can contain only so much population. If that goes that way, at every level, at every unit at that level, it will be of uniform size. That means, neighborhood parliaments would be of the same numerically uniform size, and ward parliaments will all be of the same numerically uniform size. Same way, state parliaments will be of the same numerically, that means only can represent that much population. So even the nations, it can have only so much people. That means, no more bigger number bigger nations and smaller nations. Every nation of the same size. And if every nation is of the same size, no more border wars. If no more border wars, practically no war at all under a world government. If no war at all the money that goes for killing in terms of defense expenses, in terms of nuclear armaments, all that money that is eat away, mostly half of the nation's budget, will go for constructive purposes like health, education, and various other things that promote total well-being. And then we go to the third principle. Now we said at every level, this has to be a small-sized parliament. First level, second is all small-sized parliament. When at every level it is small-sized, and one level elects the next level, not directly from the base state to the national parliament. One level elects the next level. Then what happens? Anytime you are not happy with the person you elected from, say, from panchayat level to block level, you can, at any time, any day, you can call your parliament, that is small-sized community, and you can decide to call that person back if anybody doesn't do the job well. So if at every level you can call back an elected representative any day, it means power remains constantly on a day-to-day basis at the hands of the people at the base. And if the power is with them, then their problems will be addressed, their health will be ensured, their total being will be ensured. Then next principle, this principle I recall, and then then we come up with the principle of subsidiarity. This is action and decisions at the lowest level possible. We are speaking about a multi-tier structure, and there will be a tendency to centralize everything, and the people at the top say all the powers are ours. Then what happens? People at the base feel they have nothing to do, and when they nothing to do means they don't come together to make deliberation. They cannot participate in governance. They cannot share power. So we give this principle: whatever can be done at any low level, don't take it to any higher level. Any decentralized level, don't take it to any centralized level. The higher levels or centralized levels or main levels are to deal with only those matters that no lower level can handle. If that is the approach, most of the powers come to the people at the base. And then most of the decisions have to be taken by the people at the base. When most of the decisions are to be taken on the people at the base, It has to be done in the neighborhood parliaments. Neighborhood parliaments are small in size. And then when they take a decision, since it is small in size, they'll have to consult everybody. Because otherwise they will say, am I not here? Why didn't you call me like that? So when they consult everybody on almost all the issues, all the important decisions, everybody feels valued. Everybody feels that they are also persons of worth, not non-persons. And then they get recognition. And then, when it comes to mental health, one big issue is this lack of recognition. And here, almost for everything they are consulted, they are constantly recognized and reinforced, and their mental problems will come down and people will be happy. And then we give a kind of principle of convergence next. This is to say, we just ask the people, how long will it take for the entire world to get organized at first level as neighborhood parliaments only? And then people give various answers, and we are there till the one day will be enough. Because to organize your neighborhood, you don't need to take a bus. And then to tell the whole world that this has to be done, this is important that you come together in your neighborhoods and elect to begin with the convener. And because so much benefits for health and well-being will be coming through that system. To tell the whole world like this, with all the media available, we don't need more than a day. But so it is easy to react actually comparatively to organize these parliaments. The details we will explain later on when you have time. But the more difficult thing is to sustain these parliaments, to make people want these parliaments, to actively involve in these parliaments. How do we ensure that? And then what we say, what we found in our experience, when a group meets together when it has a reason to meet, when it's a task to do, when it's an activity to perform, their responsibility to shoulder. So the more tasks they have, more activities they have to perform, they come together. More roles they have to play, they come together. So we say, if you want these structures to be strong from below, then see that whatever you want to do, you try to see that they converge through these neighborhood parliaments and their structures. So when they have enough things to do together, they come together, then they interact, they become more and more cohesively collected, gel together, and then they develop a kind of we feeling, a kind of collective ego. And when any group's collective ego is adequately reinforced, they will not allow anybody to bypass them. The parliaments at the base will assert themselves and demand their due, then the rest of the things will follow easily. So this kind of 5 principles we give. And along with 2 more principles we give, there's some sociocracy. That means, sociocracy is a little better development. Okay. A little higher development than democracy. But the problem with the democracy is that it keeps dividing people because it's majority based. Every time there's a decision, you count who is this side, who is that side. And one side wins and exuberant, and another side despondent, angry, indifferent, non-cooperative, and so on. Same way when it comes to election. So this sociocracy proposes new types of decision making that are not majority based, and new types of elections that are not majority based, but very interesting type of elections, which you have been doing it in various places successfully. And at the end of the decisions and at the end of elections, everybody is happy. That type of decision making, not unanimity, not based on unanimity. Unanimity is a bit difficult to arrive at, or a consensus difficult to arrive at. They go by a principle of consent-based decision making. consent based. That means no objection. That's a very interesting process that every time they come together, the society, community gets built and better, stronger unity rather than getting divided. So this way, all these things put together, we have proposed a system called neighborocracy. If this is implemented, power will be with the people, where the power should be. People who are sick, hungry, not respected, and all those people, and they will have mental, physical, mental, social, and spiritual well-being. And we start this through children's parliaments. And every neighborhood parliament of children, we have a health minister. And every neighborhood parliament, we have a health minister. So like this, a kind of a network from below, a community is organized from below to ensure that they have everything that's required for their health, not merely medicines, but also food, respect, dignity, justice, belonging, affirmation, recognition, and everything. So I stop here. Thank you very much.
Thank you. Within a short time, I know this topic needs extensive discussion, but due to shortage of time, we'll take it up on some other day. We have daily sessions taking up on various topics. So any one of the convenient day, we will take it up. So we'll quickly take a very brief query or comment from Mr. Sanjay. Yeah, Mr. Sanjay, you have been unmuted.
Ravindra, I think you need to keep the chat open as well as the mic open, because there's no point in having a presenter if nobody can interact with that. And we have come here specifically to donate and to ask that we can actually interact. Father Edwin, will you please explain how the health connection and the laboratory governance are interrelated for social upliftment? The link and the presentation could not clarify that point.
Yeah. See, basically,
how do health outcomes in a society get improved through laborocracy and sociocracy built into the process of engaging amongst the people of the society?
Okay. Health we explained as not merely the absence of disease, but a state of physical, mental, social, and spiritual health. That is total well-being, which is expressed as the fundamental human right. And so health involves not merely medicines, not merely doctors, not merely hospitals, but also good food, good air, good environment, good water, good relationship, good peace of mind, and then recognition, affirmation, respect for people. All these things are all included in health. So we need, if we want a healthy world, we need a world where people's basic needs are met, and basic psychological needs for recognition, affirmation, respect, dignity, everything are attended to. And this cannot be done from the top alone. Everybody has to involve in this process. If everybody has to involve, they have to come, they must have forums where they come together, discuss and learn about health, the various requirements for health, and various steps to be taken for health, and then make decisions and act on them. And such kind of forums are needed, not for just a few people, but for everybody. Our topic is people's health in people's hands. That means people, that everybody must be enabled to make their contribution to make this a healthier world. And for this, we give them forums to come together. And in these forums, there could be these neighborhood forums. We could call them neighborhood health communities or neighborhood health parliaments. People could learn together on what could promote health. They could learn together on how to prevent aspects that bring disease, and they could learn together and on whatever they can do in a community or individually to ensure that everybody is healthy. And so for this, we have also in each neighborhood of 30 families, a health minister. And this health minister's role is constantly to alert them on whatever they need to do with regard to good water, good air, good environment, good nutrition. And then he can also alert them on the possibilities of various types of therapies, including natural therapy and medicinalist therapy, and then various types of therapies they could introduce, and then they could plan together and whatever they could do. And this way, and they could have a kind among themselves a mini health insurance program. And we have one example in one place known the health volunteers, which we mean health ministers here. The primary and the preventive and first primary health care they take care of. And they are organized centrally through a referral hospital. When these people go there, they know this comes from this community, and then they try to see how best to help them. And people feel safe and secure, and the treatment also becomes very cheap and affordable. Today, I have no time to go into detail into those things, but another day we could explain in detail. So various ways this can help. And the moment you have a warless world, you already have quite an amount of good health. So all these things are possible when the power comes to people who are the ultimate stakeholders when it comes to health.
Yeah, thank you, Mr. Edwin. Actually, when we see the good olden days, what was happening, we lost the culture. Actually, we lost the understanding of the meaning of culture and traditions. The values are lost in the process. We have become so selfish, so mean, so materialistic that we were only concerned of ourselves rather than being concerned of the community at large. That is what made us today gave rise to more disasters or more what we are seeing now, the determinants of various social evils, because a proper lack of proper understanding of culture always leads. Today, even everyone was talking about different determinants of health, because health, what happened, we have restricted itself to only the physiological aspects of health. That's what made health more complicated, and today we are paying for that, because always we have to be broad-minded, open-minded, and we have to be open in understanding different cultures and traditions through which these traditional knowledge systems have been passed through generations. They have given sustainable models, but the present models, which are not at all sustainable, what we have seen through various revolutions, green revolution, white revolution, blue revolution, or we can go on talking about so many revolutions, which has brought so much of use of fertilizers, massive production methods, rapid industrialization, urbanization, without a proper outlook, which has created more conflicts, more unrest, and more inequalities among the society. That is what we are trying to focus on. But for this to understanding, people need to have a broad perspective. It's not that today we are very mean and selfish and we cannot keep talking about so many things. First, we have to be open-minded and broad-minded, accept different traditional knowledge systems which were sustainable since thousands of years. That is only solution. Now we can save our world. Otherwise, this will continue, and in next 100 years, will destroy our planet completely. That's why this appropriate theme of the year, our planet, our health. Health is not restricted to one's physiology, but health is a very broad concept which is applicable to entire planet. Health is not just limited to human health, but also animal health and also planet health. That is environment health. So unless and until we are open to all these aspects, unless and until we are concerned, we treat equally our health, human health, as equal as animal health, as equal as environmental health, this is not going to change. No matter how many discussion forums we open up, but the basic change has to come within ourselves. Unless and until we change ourselves, nothing is going to happen. No matter how many conferences, seminars, we see in the IPCC report that most of the coastal areas are going to be soon disappear, going to be submerged in the ocean. Now, who are the culprits here? we are destroying our own planet. We are destroying our own health. And whom we are blaming today? It is we. We have to blame ourselves because of the acts which we have done irresponsibly towards our nature, towards our planet, towards our community. So without holistic understanding of the environment is, our planet is, merely we have taken modern science as the ultimate science, and we have created a lot of disasters, diseases and disorders. So these rapid industrialization and urbanization without an holistic approach to all these elements or determinants of health, that is animal health, human health and environment health, has always strained our relationships with the animals, that is both flora and fauna, and planet health, that is environment health, and as well as human health. Our focus was mainly on human health, totally neglected on animal health and environment health. That is what today brought us to the verge of destruction, and we are continuing to destroy our own planet. And this is the only planet we have. We don't have any alternative. If this is gone, we all are gone. So it's high time that we all together work for the healthy planet and wealthy planet. Today, our health entirely depends on the health of our planet. So it is rightly said, clean our air, clean our water, and clean our food. Now we have to move to sustainable development methods. Why we were talking about so much about Millennium Development Goals, and today we are talking about Sustainable Development Goals to be achieved by 2030. So if initially when these development models were initially sustainable, then in the very first place, why we need to talk about these Millennium Development Goals and we failed to achieve them? Then we took up Sustainable Development Goals, and I don't think the way we are going, the direction we are going, we will even not able to achieve. It's already 2022, and to the extent we have achieved, more concerns are coming up that we have destroyed the planet to the extent where it cannot be restored. And we have seen the kind of acceleration that we human beings have made to the destruction of planet, that it took millions and billions of years for the planet. It was sustainable, but with our 200 or 300 years of this modern science evolution, we have destroyed the planet which was there since billions and millions of years. Now, who is responsible for all these? What science we have evolved and what kind of technological developments we have evolved in the process. And we need to reflect upon this. We need to go back and check where we have gone wrong. It's only because our selfish motives, our greed, and other practices which has led us towards the destruction of our own planet. Today we are talking about so many things, about holistic health, holistic development, sustainable development, which was there as part of our culture and tradition since ages, since thousands of years. But we have neglected it. We have become more materialized. We never cared for our nature. We never cared for our natural resources. That is what today we are paying for. Today climate change is affecting everyone in the, no one is exempted and no one is being not, today everyone is paying for that. Climate change affects everyone, even the rich and poor, even every nook and corner of the planet. So, nature, we are waging a war with nature, which we can never win. We have seen many times the nature has always has its own mechanisms to control and restore its own ecosystems. And we have seen our technology or our science and development couldn't save us from the wrath of nature that was due to our abuse of nature, our discrimination, our inefficient use of natural resources. Today, there are many issues like deforestation and various developments that are taking place in the forest areas, in the valley, river valleys, and various conserved protected ecosystem, biodiversity areas. They are destroying the rich biodiversity in on the planet. It is seen everywhere. So these are the practical issues that we need to talk about when we are talking about health. So community engagement is very much important, and that has to be taken up. And we need to definitely go back to our traditional knowledge system. That is only going to save us. No matter what, it is clearly proved that this modern science is not going to save us. It will still lead to further destruction. Why this has happened? Lack of values. Value education is lost. Today, we are running a rat race. We are very selfish. We just want to we are so greedy of ourselves that we don't care of others. We don't care of community. Lot of philanthropy, charity was part of every individual. But today, we don't care when even the other person is dying. So this corona has showed, COVID time, how many people suffered. So all these things, nature has its own way to protect and correct the systems on the planet. No matter one space storm in the space can destroy entire satellites, and we will end up with nothing. And without satellites, you can't imagine, nothing will work. All the systems will collapse. So, are these sustainable practices? We all need to ask ourselves. So, there is a greater role or a greater cause or a greater issue that needs to be discussed rather than superficially discussing on few things that will never serve the purpose. Today we might have everyone got doctorates, but what are those doctorates for? Without having basic knowledge, basic concern for our own planet, for our own nature, these degrees doesn't hold anything. Today we are rushing out to save every minute, every second of our time. But for what? To destroy ourselves? That is the question we have to take. Today we don't have even 1 second for ourselves. We are so intolerant. We are so impatient. We are so restless, even to wait, even to hear, even to listen, even to work on these developments. So these all are causing a lot of issues in achieving sustainable development. Today, because all the eminent speakers have spoken about various determinants and aspects of health, I'm not getting into details of that because the time is also running out. We already exceeded our time, so we are not taking up any queries as of now. So you can always post your queries through feedback form. We'll be sharing it right now in the chat box, and we are very sorry because we don't want our participants who have joined to take much more time. Definitely, we have daily platforms we are discussing on various issues, and on Sundays also we have a very spacious platform where we are discussing since morning to evening. So definitely there are platforms available. If you have time, we have time. We have the platform to discuss, to disseminate knowledge. We welcome you all. This is an open platform. We are organizing so many programs and sessions. Do come us in advance, inform us in advance, so that we can also take time, because we are also running up. We also have our own schedules, being academician, being practitioner, being have to manage all other things like you all. Even we also manage, and this is an additional work we do without expecting anything. So we all need to plan in advance so that we have to organize in an efficient, hurrying up in the last minute and making such things will always put stress on all of us in terms of time, in terms of resources, in terms of discussion. Because any topic which has to be informed clearly to all the participants so that they can also come up with the points and they can have a better discussion. So thank you, Mr. Edwin, for joining us, and all the speakers, especially who have joined us for the wonderful day, for giving insights into various aspects of health. I wish you all once again World Health Day, and we are organizing various programs on this World Health Month. So do join. So if you let me know, like daily we have sessions from 5:30 to 7:30, and on Sundays we have from 10:50 to 3:30. So you can clearly inform us so that we can take up this topic again and we can discuss in detail. We can also invite our other friends and we can discuss on that how sustainable development can be really sustainable. So thank you everyone. Yeah. Yeah, Leslie. Yeah, we'll quickly have your query. Less than 1 minute before I pull up the feedback form. You can have your query or comment.
This is for query for Father Edwin. Hello, Father. How much of indigenous knowledge or indigenous systems have been observed in your journey? As far as I can understand that they are the protectors of forests, they are the protectors of environment, and they don't depend upon wage, but they depend upon the nature for their livelihoods. So how much that has gone into your thinking in preparing this neighborocracy?
Yeah. Everywhere, people need to be organized and included and empowered. And only such empowerment by a structured inclusion, a sustained inclusion, could help people to solve the problems, I mean, especially of those who are the indigenous people, whose livelihood and future is now threatened. So they especially need all the more this kind of system where they are duly integrated and empowered. Thank you.
Thank you for that.
Thank you. And all feedback form has been shared in the chat box, so everyone can fill up the feedback form, and you'll be receiving participation certificate within 15 working days. Kindly do join Telegram channel, where the certificate download links will be provided. I thank all the eminent speakers of the day, Professor Dr. Garima Sharma and Dr. Kanika Vasishta, Srimati D. Divya Bharati, Sri Matt Perlestian, Sri Balaji Sundaram, Mr. Edwin John, and Sri Dr. Ravindra RM, and all the eminent speakers for the day, and especially the participants without whom we couldn't have been, this event couldn't have been successful. Thank you once again, everyone, for joining us, and do join tomorrow's session at the same time with the same link with a different topic. Thank you, everyone. Feedback form has been shared in the chat box. You can fill the feedback form before leaving this webinar. Have a great day. Good night. And wishing you all happy World Health Day. Thank you, everyone. See you all tomorrow. Good night.